of freedoms, Lord, and we recognize you as the head of it. In Jesus' holy name we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you, Pastor. Mr. Banias, go ahead.
Thank you, Your Honor. Members of the Court, we have various announcements relating to the agenda this morning. First, just to make everyone aware, we do have two public hearings this morning, one from the county clerk and one from the district clerk. At the conclusion of those public hearings, we're going to ask the Commissioners Court to take action on each one of those items that are presented. Under the County Administrator's Office, item 9A9. This is the release of payments for the Emergency Rental Assistance Program. We're going to take that up after closed today. And we will be, even though we do not have anything on the closed agenda, we need to discuss various economic development and other items and advice of counsel. So we are going to ask that we go in closed today. Members of the Court, you might also notice that we have a work session today. We believe that this is going to start at about 1:30 this afternoon. It's the final work session as it deals with providing information on the 4 pillars and as it relates to the American Rescue Plan Act, ARPA. Also, just remind the court that we are not going to be holding Commissioners Court for the next 2 meetings. I believe our next court meeting is going to be October 19th.
Thank you, sir. Board members, you have before you the minutes of our regular meeting of September the 21st.
Move for approval. Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Fickens. Commissioner Johnson?
Yes.
Motion passes unanimously. Under proclamations and resolutions, Commissioner Johnson, I know you have a resolution.
I do, Your Honor, for Ms. Laura White. Would you please present that to her since I'm not present?
You bet. I'm going to ask the family to come forward at this point in time, and then I'll read the resolution and then come down and present that to you. Whereas Laura Wiley is being recognized for her quick thinking and heroic efforts that saved the life of her grandmother, Karen Rutherford. And whereas Miss Wiley is a 14-year-old freshman at Boswell High School in Saginaw, Texas. And whereas on August the 2nd, 2021, while enjoying lunch with her grandmother and siblings, Miss Wiley observed her grandmother choking on a piece of food. And whereas Miss Wiley jumped into action, performed the Heimlich maneuver on her grandmother, successfully expelling the trapped food from her airway. And whereas Miss Wiley demonstrated extreme bravery and poise during a very frightening situation, saving her grandmother's life, now therefore be it resolved that we, the Commissioners Court of Tarrant County, are pleased to recognize an outstanding young citizen of Tarrant County, Miss Laura Wiley, in witness whereof we have herein to set our hands and cause the seal of Tarrant County to be affixed this 28th day of September 2021. Commissioner Johnson moves its approval and I'll second it. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. You are welcome to stay and talk as long as you want. Sure, come on up up here and turn around. In fact, we've got somebody, y'all can go back there and take a picture. She's gonna snap at least 3 times. Did you get all, did you get? I got several. You got several. We want to make sure. Well, if you would like to make any comments, you're welcome to do that.
Oh, that's awesome.
Uh-oh, she sounds like a future politician.
Well, no, this one over here is our future politician. Well, I just want to say I never really realized how precious our life is until that moment when I was really scared. And I'm just so proud that I have a granddaughter that was able to have the strength and the courage, and she'll always be my hero. And like they said today, she's a shero. And so that's really all I have to say. But I thank you all for recognizing her, and because she is special, and just we're so blessed. So thank you.
We're glad you're here.
Outstanding.
After all we read, it's nice to hear the positive part and know that we've got youth coming up that will spring into action when they need to. We think we're very, very excited about this today. Just any other announcements anyone has today?
Yeah, thank you, Judge. I do have some announcements. We have a series of events coming up in Precinct 2 related to our priority issue areas, the first of which is an elections town hall. This will be virtual and streamed via Facebook Live. That's Wednesday, October 13th from 6 to 7 p.m. We will also have 2 redistricting input sessions. I know we'll be talking more later about the initial assessment. I'll share a little bit more about those at that time. And then on Monday, October 25th, we will have our quarterly JPS bond update meeting for our community. That will be virtual as well via Zoom. So please, if you have not signed up to receive updates from our office, you can contact our office to do so, 817-248-6099, or email commissionerprecinct2@tarrantcounty.com. I want to make sure that the community stays up to date on what we are working on their behalf. And then also, I just want to provide a thanks to the efforts of emergency management and public health, as well as Mansfield ISD, Arlington ISD, and Benton Plaza for assisting us in standing up additional testing locations, drive-through testing locations, which of course are open to anyone. But as we are still very much experiencing the surge with COVID and the Delta variant, it's important that we make those resources readily available to our community. So just wanted to provide the thanks to the team effort to get those up. That's all I have. Thank you.
Yeah. This is National Voters Registration Day, and then we've got activities going on all week as far as locations that we can register people to vote. Today, we can folks can register from 8 till 5 at Northeast Subcourthouse, Northwest Subcourthouse, River Oaks Public Library, and Tarrant County Elections Administration Office. Tomorrow, they can register at Charles F. Griffin Subcourthouse, South Lake Town Hall, again, Tarrant County Election Administration Office, as well as the Azle Memorial Library. Thursday, Mansfield Subcourthouse, the administration building here, and then also the Election Administration Office, as well as Woodland West Library in Arlington. And then on Friday, again, the Elections Administration Office, the Crowley Public Library, and Summer Glen Branch Library. So I would hope that many of y'all will take an opportunity, if you're not registered to vote, to get out and to get registered. Any other announcements? Then with that, court members, you have before you the consent agenda.
Move approval of the consent agenda.
Second?
We have a motion and a second to approve the consent agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. We do have two public hearings today. The first public hearing is considering the annual plan for the preservation and restoration of records archives for the county clerk. Ms. Nicholson?
Yes. What are we talking about? Oh, okay, I'm sorry. Yes, we submitted our preservation plan to the court's consideration. We feel comfortable about what we offered and what we're gonna do, and, records are the most important things to preserve, and obviously we wanna digitize and put things more out on the web and harness technology and make that happen.
I will open the public hearing at this point in time and ask if there's anyone here wishing to speak to this matter, and I believe Mr. Devin Pipes is here to talk about that. And
The comments here, he did not wish to address the court, but would like to register the following opinion.
Okay, and with regards to the county clerk, it basically just says, I'm against this until previous projects are made accessible and costly mistakes are fixed. So if there's no other people wishing to speak to this, then I will close the public hearing and ask for action at this time.
Move approval.
Second.
We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Judge.
Next, I will open the public hearing regarding the annual plan for preservation and restoration of record archives for the district clerk.
Good morning, Judge and Commissioners. I do have a brief presentation this morning. This has been a long time coming, and I'm very happy about the effort my staff has made. I have Ms. Paula Ford here today, who's the disposed records supervisor, and a lot of this credit goes to her. I'm happy to report today that the monies that come out of this fund pay for the following results. Out of 2.6 million district court cases, that's criminal, civil, family, and juvenile, we have imaged 90% of those as of the end of the fiscal year. That's 2.34 million cases. All that is left to be done there is, like I say, about 10%, but we have the quality control yet to do that the Supreme Court mandated on us without much input back in 2014, and then again they added to that. So that slows us down, but once we get that done, we can destroy the paper records, and we are actively doing so. We're destroying 200 to 400 boxes a quarter, where they're all quality control. We've got good images, and I'd also like to commend the IT department. The backup, the redundant backup they have. We've been paperless since 2019 in all courts. You can't do that, and you can't destroy the paper without having a redundant backup plan. And I actually had a meeting yesterday, our monthly meeting with the CIO, and reviewed, made sure there were no unforeseen changes in that plan where court records would be accessible to the citizens, the news media, many companies that access it, also in the courts themselves, right up on the bench where the judge is. So the only change really that I would like to point out to you, we ask that you re-up the fee for the last, or actually the first 3 months of the new fiscal year, because all of it changes January 1st to a combined fee, which the legislature put in, that is still somewhat obscure to many of us, but we're working on the details on that with the budget office and Russell and the county clerk and others. So I ask for your approval of the district clerk's records plan.
I'll open the public hearing at this time and ask if there's anyone here wishing to speak to this matter. Again, Mr. Devin Pipes has indicated that he supports the plan and that Tom and the staff are doing great work. Are there any other folks here wishing to speak to this matter? Then I will close the public hearing and ask for any action the court may choose.
Approval.
Second.
We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you.
Your Honor, just to make clear on the records, that motion also included the setting of the renewing of the fee for $10. Okay.
Yes.
That was in the plan as well, okay.
Okay, Mr. Manius.
Thank you, Your Honor. Members of the court, as we go to item number 1 under the administrator's office, we're going to ask Mr. Tenasia to come forward at this time to make his public health presentation.
Good morning, Your Honor, members of the court.
Good morning, Vinny.
Back again this week with hopefully a little bit of good news. So our cases are, starting to decline a little bit. This morning we added about 408. I think yesterday we were in the 780, somewhere in that range. Overall, we're at 343,000 and I think 700 something total cases. Death count's definitely increasing, but I expect that to slow down over the next few days as we sort of go over the surge in deaths that correlated to the surge in cases. The total number of deaths are 4,247 in Tarrant County. Hospitalizations are trending down, so that's great news developing. Currently, we're at 928 people in the hospital confirmed with COVID. That's 20.68% of the hospital capacity in Tarrant County. Pediatric hospitalizations also have started to trend down a little. We'll watch it for a few more days because the numbers have been a little unstable. But it's 32 as of yesterday. That's 7.55% of the bed capacity. Day before it was 41, so I'm just a little unsure if the reporting's all 100%. And then the trauma service area E, 2833 total. Again, a decline happening in the trauma service area, also 17.85%. The chart on the right shows the whole metroplex, so to speak, the 19-county trauma service area E. I expect the colors to start lightening up. I see that Dallas already is a lighter shade than us, so declines are starting to happen in major population centers, so we should be following suit here as well. So trends in the county, obviously the chart on the left, it's the case surge. The recent couple of bars, obviously more data is yet to be reported, but you can already see a downtrend developing after a peak that was about maybe three to 4 weeks ago. This is all retrospective. Once you chart it, it takes a while for it to actually show what the trend is. And then the death surge is still continuing on, but we expect that to really start to decline. The real good news is the R0 number. It's 0.82. So below 1 is great, and we'll take it. The virus is starting to slow down in the community.
0.082 is really an improvement.
Yes, it is. From just a week ago, we were at 1.03, so things are looking better. Positivity rate finally has kind of broken out of its plateau to the downward side. I think we're at, I can't read that, but I think we're at like 18% if I remember correctly. Still high, so it's not time to rejoice and go out and do a lot of things, but we're starting to see a break happen, supported by other indicators. As you can see, the COVID-like illness is really starting to sharply decline. Case rate is starting to decline. We're at 376, I think, per 100,000. So that's a significant lowering from 524 per 100,000. So all of the indicators are in sync, pointing to a decline coming in the next week or two, which is good. You know, we want to make sure, you know, we enter the cooler weather in a low. Because again, at the holiday time, what happened last year? Families got together, we had a surge. So the messaging is going to be, we just got out of this, be careful, get vaccinated, wear your mask if you're not vaccinated, all those type of things. So, you know, those are the things that we're going to continue to reiterate. But like I said last time, there is some good news developing. Merck has a potential oral antiviral that they completed clinical trials on. I heard news that Pfizer is looking into something as well. So hopefully, by the end of this year, we'll probably have an oral antiviral that helps us manage this better at home. Because y'all have heard the frustrations from people. The only option is, if you're sick, stay home. And if you're really sick, go to the hospital and they'll treat you in the hospital. That's not not a lot of choices for folks. And the oral antiviral will make it very manageable. You start the course early like we do with Tamiflu for the flu, and then hopefully it will reduce the illness duration and the viral load so you don't really infect a lot of other folks. So it will become a lot more manageable once those medications are out. Case trends in Texas. Again, this is more hospitalization chart, but I wanted to show that there's a significant decline happening in cases all across Texas, people that are hospitalized. So that's great news developing. And then the national chart is starting to show a similar picture that, you know, we're seeing a break in cases. What is interesting to look at the national trends is how it kind of shifts from one area to the other. It started in the southern 7 or 8 states in the southeastern United States and all the way to Texas. And now there's 2 centers, sort of the Appalachian region, Kentucky, West Virginia, and then northwest of the United States. So it's kind of moved off in a surge. Those states are, you know, impacted heavier than we are. We're starting to lighten up.
Well, at least Nebraska woke up.
Yeah, they woke up with their reporting, yes, sir. All right. So the message is, again, the same. Get vaccinated. It's in plenty of supply. A lot of locations. If you really need to find something, our website, tarrantcounty.com/vaccine finder, has a lot of choices. And we link to other places where you can look at private providers also. So, and then wear a mask, you know, it doesn't hurt. And then, of course, avoid unnecessary large crowds. You know, work-related things, we come to Commissioner's Court, those are important things you got to do day-to-day operations. But other things, just for fun, you know, try avoiding them while the surge is on. And then once the surge is off, hey, go back to normal. And then vaccine updates real quick. Slow but steady improvements, I like that. We're over 1 million people fully vaccinated in the county. That's 58% of the eligible population of over 12, and then 47% of the total population. And then steady improvements in all age categories, race categories. So things are starting to, you know, slowly get to a point where we're starting to get a little bit more comfortable that, yes, people are uptaking the vaccine, and that's good news developing. So the big news over the last week in several iterations was the Pfizer booster doses. And, you know, it can be confusing to watch the process unfold. It was a multi-step process. There was an advisory panel for the FDA, then there was the FDA committee, then there's the advisory panel on immunization practices, and then there's the CDC. So for people who really just want to understand who's the final say, for an immunization program, the final say is the CDC on how it will be implemented. FDA approves the medication, but how it will be implemented, it's done by the CDC because the program operates under the CDC. So they approved, everybody agreed that Pfizer needs a 3rd booster dose for the general public. And the logic was, Pfizer had less of a dose of the mRNA in their vaccine. So I think it was like 30 milligrams in each dose. So it was 30 and 30. Moderna did not get the same approval because they had 100 and 100. So that's what the data is currently showing, that people who got the Moderna maintain their immunity longer. If that changes, I'm sure they'll come back and look at that. But for now, Pfizer got approved. And they did not approve it for everyone. So I want to make sure people understand that. Our county's a big county. We have over 1 million people vaccinated. 650,000 of those got the Pfizer vaccine. but that doesn't mean all of them are eligible. So they have a lot of categories, and I'll go through over the next couple of slides on who's eligible and who's not. But a couple of quick updates here. Our Fort Worth site that launched in Wilkerson Grimes, the city ran a drive-through. That's off to a very good start in the 76119 zip code. And we've talked about it. There are some areas that lag behind, and that zip code's off to a good start with this new site. I think almost 900 plus doses given last week, so that's great news.
So Vinny, this is just for the booster or is for all of them?
No, all of it,
Okay.
yeah. So, and then, so now I'm talking about the boosters. Because, you know, it was a lot for even us public health folks to like understand how to implement all of this. So first of all, Pfizer only is approved for the full third dose booster. You must be at least 6 months out from your second dose before you become eligible for the third dose booster. And people who are recommended, you should get the Pfizer booster, are people 65 and older, people 18 and older that may live in a long-term care facility of any kind, or people 50 to 64 with underlying health conditions. And we've already gone through those underlying health condition list is long, obesity, diabetes, blood pressure, lots of things. These are the people who are absolutely recommended you should go get your third booster shot with the Pfizer vaccine. Then there are people who are eligible who may get it. That means they're okay if they want to receive it. It's not absolutely a must that they must go get it. And these are folks 18 to 49 with underlying health conditions, and 18 to 64 who work in high-risk exposure settings, like healthcare workers and other institutional settings, and there's a list. But the issue is CDC and the FDA, all of them have left it up to an individual to make that decision based on your risk assessment of how you live in your life. And if you really need some counseling, you can talk to your provider. If these folks come to us or any vaccine provider, nobody's going to turn them away, but the choice is theirs. It's not a strong recommendation that you must get it, but they're authorized to receive it. So then what is a high-risk exposure occupation? Because a lot of people ask that question. The list is not all-inclusive, but they gave us examples. First responders, healthcare workers, firefighters, police, congregate care staff, whether it's long-term care facilities or in a jail setting, educational staff, teachers, support staff, daycare workers, food and agriculture workers, manufacturing workers, correction officers, U.S. postal workers, transit workers, and they said grocery store workers, but what the call was about anybody in a retail setting, restaurant folks, other retail stores. You have a lot of exposure day to day to the public. So that's where, you need to kind of gauge your own risk and then come ask for the vaccine. Before I get to testing. So how do we do that? Not everybody needs to rush out today to go get vaccinated. You can do it at your own pace. But if you come to our website, like I said, there's a lot of choices. We have public health clinics obviously open, a lot of pop-ups open, several partner entities like Fort Worth, MedStar, City of Arlington, all have different locations open. There's over 150 pharmacies in Tarrant County that have current stock of vaccine, and it ebbs and flows. Some days there's more pharmacies that have it. So check with the local pharmacy. If they have Pfizer, you can go there. You don't have to go to one particular provider. But what we are doing is that we now have the state registry database. We looked at currently people who are 6 months out and had their Pfizer dose. The easiest group to identify was people 65 and older. We don't always have the information on underlying health conditions, so we took a total number, about 115,000 people. So slowly every day, we're gonna start reminding people, hey, looks like you're over 6 months, you're eligible for your Pfizer dose, you can go to any provider, ask for your Pfizer vaccine, and that way everybody gets to participate in a more orderly fashion instead of everybody standing in line at one location. So that's kind of the plan for how to go through this. Because there's not an immediate rush that it's 6 months plus 1 day and I need to go get it today. We can take our time. Okay, so last slide I think is the testing operation.
Yeah.
Yes, sir. Go ahead.
What about those of us that have taken the Moderna and we've got our booster shot with Moderna?
Yes, sir. So we asked that question with the CDC. So anybody who received either a Moderna booster shot or a Pfizer booster shot already does not need a fourth dose. So good point of clarification. Some of the folks got it because they had underlying conditions that were immunocompromising. They already got their booster. And we asked, like, do they need a fourth dose now that this is approved for everybody? And they said, give us a few more months to find out what the data shows. It doesn't appear at this point that there's an additional booster needed, but we'll develop that guidance once more time passes. And then Moderna otherwise is approved for that immunocompromised group for that booster. The difference there is you must be 28 days out from your second dose, and you must have an immunocompromising condition. And you're 18 and older, Moderna is approved for that, but not for the general public like Pfizer was. Lots of nuances, I know. And we have it on the website, CDC has it. It's just a lot of complicated things.
Commissioner Johnson, are you done?
I'm here. Yes, I'm done.
Okay. So, Vinny, I want to make sure I'm not putting words in your mouth. You said that for the Pfizer vaccine, that providers will not turn people away.
Correct.
Okay.
They're going to ask you some questions. Why do you think, and do you fit in these categories and so forth, but nobody's going to turn you away.
Okay.
Now, you have to make a self-risk assessment. I'm going to cite what CDC exactly said. We're not encouraging people, healthy young adults, to come and get the Pfizer third booster. You do not need it. You're going to take something and then maybe complain, oh, I got a side effect. Let's not do that because you don't need it. But people with underlying health conditions or with congregate settings of some kind or all these other things that we listed, those are considered higher risk. So those are the folks that are highly encouraged to go get their vaccine.
Thank you.
Okay.
So before we go to
Yes,
the
sir.
testing, you know, some of the individuals that'll be qualified to take the third shot are confinement officers, juvenile detention officers, CSCD, the Sheriff's Department as far as the law enforcement, also the constables. I believe what we're going to do, we'll get Vinny and Ms. Glenn to put together some material and get it out to those departments and make sure that if there's any one of our employees that want that third shot of Pfizer, that we'll give it to them right away. Because we live in very close quarters in the county jail. And we deal with people on probation, and we've got juveniles that our employees are in a confinement department also. So we need to reach out to make sure that if any of our employees need that third shot to qualify, then we need to make sure they get that.
Yes, sir. And you brought up a good situation. So because these were county employees, a lot of them came to our sites. And we had Moderna in the very beginning. Mixing and matching, unfortunately, is not being allowed at this time. So they must have received the initial series of the Pfizer dose to qualify for the third dose. So I just want to make sure that's understood.
And then I know that we were also one of the first that actually vaccinated some of the prisoners. What are we doing with regards to that?
We'll simply need to get with the Sheriff's Department and see how we're going to move this program forward.
Okay.
We'll just let us do some exploring on that aspect, and then we'll get back with you all. But I would assume that we would keep the same programs that we've had in the past, because the key is to get as many people vaccinated as possible.
Okay.
I would like to suggest that we make the Moderna vaccine available to our high-risk employees who need a booster shot. Figure out how to get it done.
We'll pose a question. Yes, sir. We'll pose a question, and if we get the authority to do it, we will. Unfortunately, with these vaccines, off-label use is not very easy. A lot of the physicians are like, no, this is stuff that we can't do. It's not like regular medication, right? So there's a lot of other considerations in there, but we'll definitely ask the question and see if we can get a clarification on that.
And again, if an individual wants the vaccine, all of the pharmacies or most of the pharmacies are offering those.
Yes.
So they can go into the pharmacies, but if we're given the vaccines, we have to abide by what CDC has issued as far as the orders go.
Correct. I mean, FDA has their EUA. We can't violate the EUA. There's a lot of legal implications of doing all of that. So we're super careful. We do rely on person self-attestation. So if you're honestly telling us this is my health status, we're not going to question it. We're not going to sit there and ruffle through your medical records. Yeah, you have this condition that qualifies. You tell us and we'll be okay. All right. So quick update on the testing operation. So this week is last week for 5 of the 6 mobile sites. I think we're going to keep the one in the northwestern part of the county going so far. But we had 2 sites that are vendor-supported, large sites that were already running. This week, 3 more sites are launching. I think one launched yesterday at the Benton Plaza. Another one's launching today at the Arlington ISD Athletics Complex. And the final one launches on Thursday at the Mansfield ISD Performing Arts Center on Debbie Lane. So we're hoping that we get a lot of bang for that. But the numbers for the first 3 weeks looked very good. As you can see, those are there. We did maybe about 1,500 or so at each site between the 2 sites. But as we spread out and a lot of testing capacity came on, TCC had their 5 locations come on. There's a site at the UTA. There's a lot of private providers. So we're starting to see a lowering of demand at those sites. So we'll keep a close watch on the numbers and then come back and see if we need to sort of start scaling those down, even though they just got up. There's no point of keeping them going if the volume isn't there. So we'll keep a close watch on that, and we'll work with Mr. Manius' office and make a decision at some point on when they need to go. But so far, it looks like we're in a good shape, and those sites are going to be up and running.
I just wanted to add, Vinny, that on all of the sites, that there are options every single day of the week, including the weekends, and then of course the evening hours. I know that's been an issue this whole time and countywide, but so I think we've covered bases fairly well.
So just for clarification,
Okay.
the details are posted on our website,
Yeah.
but not every site runs every single day.
No.
So for these, for example, that I have up on the Resource Connection and the Northeast Annex, there were TCC sites that were so close by Monday through Thursday, so we covered Friday, Saturday, and Sunday. So testing options there, not necessarily provided by us, but it's available 7 days a week.
Sure.
And then the other 3 sites, they have a little bit of a different schedule. I think the one at Benton Plaza is more 10 to 7 on Tuesday to Saturday. And the AISD site, to accommodate the teachers, need to test in the morning. Some of the days are early morning. They start at 7. And some of the days are later. And I believe we cover a Saturday, a weekend day on that as well. And the Mansfield Performing Arts Center site is Thursday, Friday, Saturday, and I want to say Sunday, but I'd have to look. But it's at least 3 days. It's got a weekend day and it's got evening coverage.
Sure. Thank you for clarifying that. My point is that any day of the week, you should be able to go to some publicly
Yes.
provided testing location.
Absolutely,
Yeah,
yes, ma'am.
Thank you for that.
Okay, that's all I have. Oops, sorry.
Before
Either
you
way.
sit down, talk to us about influenza and what the flu shot looks like this year and when we can expect it.
Yes. So HR is probably going to bring an item, hopefully today, for employee flu shots, but we are expecting them to start soon. And then it's too early to say what the match is going to be for the vaccine, but there's 2 interesting pieces of news. First of all, influenza spiked early. So we've already been above Tarrant County's baseline for the last 3 weeks. So as soon as vaccine is available, whether at the local pharmacy, through a workplace, get it. Do not wait, because these vaccines take 2 to 3 weeks to take full effect. Weather's been cooler and flu activity has surged above baseline early. So that's that. Good news developing. It may not happen this year because this is not some kind of an emergency for the flu, but all these mRNA companies are looking at an mRNA flu vaccine. And what we're hoping for is similar type of vaccine development. The flu vaccine is a very old technology. On a good year, 60% effective. On a bad year, sometimes 10% effective, right? And that's bad odds. These mRNA vaccines have shown pretty much 90+ efficacy on most of the instances. So if they come up with a flu vaccine that can show that efficacy, now we're talking. We'll be very happy to take those vaccines when they come out. So I'll keep my fingers crossed, but it may take a few years because that's not under emergency use development. That's just regular vaccine development.
So you're expecting the flu vaccine this year to be the same
As previous years. We just don't know how the match is going to be because that's a guessing game. Last year, all throughout the world, flu was very suppressed because people wore masks, they stay home. So we don't know what's going to come out as a strain this year that may be predominant. Hopefully, they've made a good match in the vaccine.
And I believe they're giving the vaccine here in the administration building this Thursday? Thursday, so. All right, thank you, Vinny.
Thank you.
We do have an audience participation regarding the COVID and public health. Heath Cornegie. Good morning.
Hey, good morning, Judge. Thank you.
If you'd go ahead and repeat your name and where you live, then you have 3 minutes to make any comments regarding the COVID that you'd like.
Okay, my name is Heath Cornegie. I'm from Azle. I just want to talk about the vaccine and COVID right now. First of all, I want to say it's not a vaccine, but we can get to that later if you give me more time. I also understand that asking the county health director difficult questions or questioning his advice is political suicide for you all. I get that. I appreciate y'all asking questions, but y'all aren't asking any difficult questions. I do have a huge concern about the lack of questions. I'd be happy to ask them more questions, more pertinent questions, if y'all give me more time. I'm sure the public would want to hear it. And also, I know some of you want to pay people with our tax money to take the jab, and y'all know very little about the vaccine, and nobody even knows what the ingredients are in the vaccines. Nobody knows what they are. For months, all I've heard is vaccinate, vaccinate, vaccinate. The health director, he sounds like he is a sales rep for Big Pharma, working off of commissions. Surely, there are other preventatives out there. You know, anything, perhaps vitamin D, vitamin C, we could advise the population. Zinc, eating healthy, sunlight, exercise, or even natural antibodies. I know it's been mentioned up here very briefly. The CDC has a VAERS database, this vaccine adverse reporting system about all the side effects. Currently, or last week actually, there were over 700,000 adverse events in there, to include heart attacks, myocarditis, miscarriages, disabilities, and there's over 15,000 deaths from these vaccines. There's also multiple studies indicating that only about 1 to 10% of that information or patients get input into the system, 1 to 10%. So that's very concerning. I don't know why this is not mentioned. There is a thing called informed consent. I don't know what happened to that. Now, in Israel, there's a large population, very large population, that are getting the vaccine. They're getting the Pfizer vaccine, a majority of people. They also have the highest case count out of any other country. And then we have Japan, India, El Salvador, Guatemala, Bolivia. They're all using ivermectin now. They have kits that look like this. They have kits that look like that they're giving out to people, all the citizens out there. And there's reports saying that they're obliterating COVID cases by 97%. And some of these countries are COVID-free.
Mr. Cornegie, your time is up at this time.
I got 2 questions, if you don't mind.
Go right ahead.
All right, 2 questions. This is more for the medical director. Are you using ivermectin as one of your primary forms of treatment, and why? And then also I want to know, because I've talked to 3 people at the medical district, and they all said we don't track this information, which is astounding to me. What is the percentage of COVID patients recovered and deceased that have had at least 1 jab? They don't track this. I'm very curious in that number.
Thank you, sir.
Thank you.
Okay. Members of the court, if we can go to item number 1 under the administrator's
Before
office.
okay, we're still on item number 1. Okay, I'm sorry, go ahead.
We have provided you with our weekly update from the administrator's office. It breaks down the various aspects as it relates to the coronavirus. Also, it includes information on our emergency relief programs. We are simply asking that you receive and file that document.
Move to receive and file.
Second.
We have a motion and a second to receive and file. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes 4-0. Please show that Commissioner Fickus is out at this time.
Your Honor, we're about to leave item number 1. Did you have some information?
Yeah, why don't we go ahead and move to item 11 under your section? That will allow us to get folks in the audience out of the audience.
Absolutely. Okay, so with item number 11, this concerns the amended and restated participation agreements as relates to the hospital district and the county and the City of Arlington tax increment financing district. Ms. McMillan is here to address the court at this time.
Morning.
Good morning, Judge Commissioners. At the end of August, the City of Arlington made a presentation providing you information and details on their amended project and financing plan for tax increment reinvestment zone number 5, which covers what they call the entertainment district, or the district now, where AT&T Stadium and Globe Life Field and Globe Life Park are. Today, now, we have provided you the actual amended and restated participation agreement for county and hospital district participation in this zone, as noted with the terms that we described at the end of August. So today we're asking that you approve the attached resolution and the amended and restated participation agreements providing for Tarrant County and Tarrant County Hospital District participation in the City of Arlington Tax Increment Financing Zone, Reinvestment Zone number 5, as set forth in the agreements.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Mr. Mangus out there, or did I run him off?
I see.
Item number 2 is the approval of our 8th amended declaration of local disaster. I believe the one that we are currently under expires on September the 30th, and this is asking for an extension until November the 23rd.
Correct. And we're just asking you to
Second.
move for the approval
We
of
have a
the
motion and
extension.
a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. The next item on our agenda is our redistricting. And I know that, Chandler, are you?
Yes, Chandler, you want to come forward? Thank you.
Good morning, Judge and Commissioners. We have Mr. Robert Heath with Bickerstaff, Heath and Delgado to present our initial assessment findings for the 2021 redistricting.
Morning, Bob. How are you? Yeah, I know.
Just fine. Thank you, Judge.
Hey, Bob.
Commissioner. First, it's a pleasure to be here with the county and working with the county again. We've done this over past decades, and we always appreciate the opportunity. I have a little PowerPoint here, if I can.
It should do that middle button.
Oh, there it goes. I was punching it, but not enough. I want to talk a little bit about redistricting, and we will very quickly get into the situation of whether redistricting is required this year. In redistricting, there are three basic principles, legal principles we need to look at, and then we have a +1 in there. But the first one is one person, one vote. So the districts have to be equal in population, or relatively equal in population. And that's why we look at redistricting every 10 years, because once the census comes out, we find if they are equal or not. The second thing is we need to comply with the Voting Rights Act, and particularly Section 2 of the Voting Rights Act. And while there are lots of intricacies in how that's interpreted and what that means, basically it means that you can't discriminate against racial or language minority groups. And here the language minority group is Hispanic, so we're looking at racial groups and Hispanics, and we're going to need to have a plan that does not discriminate against either of those.
Does that apply to the state legislature as well?
I beg your pardon?
Does that apply to the state legislature as well?
It certainly does. And I'm not prepared to give any comment on what the current plans, how they comply with that. But they have to follow exactly these same rules. And actually on equal population, when they do congressional districting, that has a much stricter equal population requirement than it does for legislative seats or the commissioner's court. The third thing we designate here is Shaw versus Reno, which is a case decided by the Supreme Court. And while the Voting Rights Act, to comply with the Voting Rights Act, we have to look at race to see if we're discriminating. That's one of the things we have to look at and we pay careful attention to. But Shaw versus Reno says you can't make race the predominant consideration in redistricting. You can consider it, but it can't be predominant. So it's sort of, sometimes you're between a rock and a hard place. And then the third thing which we have as the +1 has to do with Section 5 of the Voting Rights Act. And Section 5 is the one where it was required in the past that anytime you had a change in election practice, standard, or procedure, you had to submit that change to the Department of Justice or to a 3-judge federal court in the District of Columbia for approval before it could be implemented. And that was declared unconstitutional, or at least the triggering device, Section 4, was declared unconstitutional in 2013. So you don't have to submit changes anymore to the Department of Justice. The standard that the Department of Justice would look at in determining Section 5 was different than Section 2. Section 2 is discrimination. Section 5 was retrogression. You can't go backwards as far as protecting minority groups from where you were before. And so that's a little different than discrimination. We still think it's important when you're looking at a plan to look at that, because if you do retrogress, if you do go backwards, it opens you up to the allegation that it is a purposeful discrimination, and Section 2 prohibits the effect or the purpose of discrimination. So we always want to look at retrogression to make sure we're not retrogressing. So the first item we always look at is one person, one vote. We need to have approximately equal population. And the rule of thumb there is that the total deviation between the largest and the smallest district cannot exceed 10%. I mentioned about congressional districts, that has to be as close as possible. So in the past, oftentimes the 30-plus congressional seats were within one person of each other. We don't have to do that. We have to be within 10%. And so you compare, as I say, the most populous and the least populous, compare them to the ideal district size. And here is how you do that. This example assumes a county with 40,000 people, so that each commissioner precinct would have 10,000 total population if they were at an ideal size. The first one there is 1,000 over, so that's plus 10% right there. The next two, they're over, but not quite that much. And our fourth one is 2,000 under, so that's 20% under. Well, 20% under to 10% over, the difference between those, or the distance between those, is 30 percentage points. That's a 30% total maximum deviation, well above the 10%. Where is Tarrant County? And we take the existing districts that were approved 10 years ago, we compare them to the 2020 census, and here's what we come up with. And to my amazement and surprise, when we did that, Tarrant County was in balance. Obviously, the county has grown tremendously over the last 10 years, but the growth has been, while I'm sure very different in individual areas, when you look at the commissioner precinct, which is over 500,000 people in each one, it's sort of balanced out within the precinct, and so the total deviation is under 2%. That's even less deviation than it was when these were adopted 10 years ago.
Bob, don't run off.
Pardon?
Don't run off. I assume that these numbers were provided by the U.S. Census.
That's correct.
Those numbers, to me, are surprising.
They were to me as well.
There are a lot of things that are counterintuitive about those numbers. I don't suppose I have a great deal of argument about Precinct 2 being the largest in population. I could kind of get there in my mind. But Precinct 4 being the second largest in population, that's something that I did not conceive of. And Precinct 3 being the smallest in population makes no sense to me at all.
You know, as I looked at that, the thing that I thought about was Walsh Ranch. Most of that would be Precinct 4. I know a lot of it's Parker County, but there's still a lot.
A lot of it is Parker County, yes.
But then in the Alliance area, when you go below North Tarrant Parkway, that's all Precinct 4. And that's where a lot of your Alliance area growth has been. So, I mean, I will say the same thing that you did. When I first looked at that, I thought, wow. Especially with Precinct 3, but Precinct 3 in a lot of areas was pretty well built out.
And we've got a number of cities that are built out. As far as large developable land, there's some areas where there's, you know, you can put together 3 or 4 or 5 lots. But North Fort Worth's in Precinct 3, and it's grown tremendously. So I'm a little surprised.
Well, as I said, I was extremely surprised, and I told our people I want to double and triple check it. And we had our senior GIS person take it, and she's worked on this for like 25 years. She's very experienced. And she took every election precinct, manually put them into the computer rather than just taking the existing map and looking at it. Manually moved everyone in, used a different software program than our first run, and she came out the same. Actually, there was a 20-person difference, and I can tell you what that was. We figured out what it was. But that was just sort of an issue with the 2010 geographic census lines as opposed to the 2020. But, you know, as I say, I was surprised. We all were surprised. And you see that occasionally, generally in smaller counties, but that's the number that it came out as. And what that means is that as far as one person, one vote is concerned, and that's the major thing you look at, you do not have to redistrict. Obviously, if you want to make boundary changes, you may, but there is no legal reason for you to do so. So you do not need to redistrict in this decade. The census is presumed to be valid. I have, in many cases, tried to convince the court about flaws in the census and so forth, and the courts are very reluctant to depart from what the census reports. So my recommendation, well, you make the decision, obviously. My advice is you don't have to redistrict. We have other charts here, and I'm not going to dwell on them, but they are here in the PowerPoint and they're in the documents that we have provided to the court, but the same sort of tables for voting age population. There's another one that's a more detailed one that has, our summary ones have percentages. These have the actual numbers of the different racial breakdowns, and when you're looking at the census, you have a lot of racial groups. We have combined some of those because if you take every possible combination of, particularly where people have chosen multiple races, there are a couple of hundred or more, but this hits at least all of the major racial groups. And there we go. Same way with voting age population. On the JP precincts, one person, one vote doesn't apply to those. So, and they are not in balance, but they were never intended to be in balance. You know, and people draw justice precincts for different reasons. Sometimes it is for population, but the Constitution says you draw them for the convenience of the people. Oftentimes they are drawn for caseload management, so that you might have a highway that runs through one precinct, and because of that there are a lot of traffic tickets, and so there's going to be a lot of work in that justice precinct. Another time there may be a recreational area, hunting and fishing area, maybe a lot of game and fish violations. So you don't necessarily need to look at population. If you want to redraw justice precincts, you certainly may. But if you don't want to do that at this time, but maybe at another time, that's certainly possible as well, because as I say, there is not a one person, one vote mandate. The Voting Rights Act talked about Section 2, you can't discriminate based of race or language minority status. Basically, what that means is, there are other things, but the primary thing is you have to avoid cracking or packing. Cracking is where you take a geographically compact minority group, which by itself say, could constitute the core of a district that would be an effective minority district, and you split it in 2 or 3 or whatever, so that then it can't elect, and you have moved those people into other districts. And that's something that would be prohibited. The other thing is packing, and it's the opposite. So you have a minority area, and you just pump everybody you can, every minority person into that district. So it's not a district that's, say, 50% or 55% or whatever that would be plenty effective, but maybe you make it 90%. Well, if you had split that one up, minority group could control 2 districts, but by putting them together, they can control only 1. I think our remote, maybe battery or something, is burning out. Here we go. There are thematic maps that we have included for you, and this one is the Hispanic concentrations, and there are Hispanic areas in virtually all parts of the county, not as many in 3, but you can see in 2 there, the darker the color, the more heavy the concentration is. And sometimes it's not so much of a problem in Tarrant, which is very much an urban area. A lot of times you'll see a big block, and you have to look to see how many people there are. If you have a big block with no people, and there can be 2 or 3 people in there, and it may show 100%, but if they're not a big group, it doesn't matter. And I'm about to put up the African American population, and you can see that it is largely in Precinct 1, also in Precinct 2. But, you know, I don't think that these demonstrate any packing or cracking to cause a Section 2 problem. The Shaw versus Reno, something we need to look at, and basically is that you can't have race be the predominant consideration, and to the extent you use race, it has to be narrowly tailored as a means of addressing a compelling governmental interest. These districts were drawn so that I think they clearly comply with Shaw versus Reno. Here's a case. This is Harris County, a case that was decided in the 90s. This is congressional districts. The upper one, the before, shows the district that the legislature passed. The red one was designed to be a Hispanic district. They found every single block they could put in that had a substantial Hispanic population. The Supreme Court rejected that, said race was clearly the predominant basis for drawing that district, and actually it did not elect a Hispanic. Although the individual they did elect, I think over the years, was certainly the choice of the Hispanic community as the years went by. But the courts redrew that, and you see that as the after plan, which is much more compact, and wasn't that much different when you look at the actual percentages. This basically talks about subordination of principles of race not being the predominant principle. And again, retrogression, the last thing, as I said before, we don't have to comply with Section 5 in the sense we don't need to submit anything to the Department of Justice. I do believe that we ought to look at retrogression with Section 5 standard to make sure we don't go backwards. We don't retrogress, because if you do, I think you leave yourself open to the accusation that you have purposely discriminated, which itself is a violation of Section 2. There was a slide, it went over, if you decide to redistrict, it suggests that you adopt criteria. I'm having problems with there it is again. Well, it was. But these are basic things, and if you decide to redistrict, we have a proposed resolution that you can adopt to do these. But things like use identifiable boundaries, maintain communities of interest and neighborhoods, using whole precincts to whenever possible, basing the plan on existing districts, adopt plans obviously of relatively equal size, compact and contiguous, preserving the incumbents in the office, and that's something that's not just good for incumbents, but constituents develop relationships with their representative, and narrowly tailoring to comply with the Voting Rights Act. And generally, if you follow these and go through and analyze the plans to make sure that you comply, it's going to keep you out of trouble under Shaw versus Reno. And this just shows the steps if you decide to redistrict. I did mention there were a few little things where some of the lines, because of changes in the census maps between 2020 and 2010, may not be precisely the same. They get more accurate every 10 years. They're very minor. I don't know if they affect any people, except one instance we saw where it affected 30 people. That's a cleanup thing. We can probably do that when you redraw election precincts, which you're going to want to do, particularly after the legislature acts, because once they act and they have plans, some of the precincts may be split, and under 42005 of the election code, you have to avoid that, so we'll have to redraw some of the election precincts. There was also an area, and quite frankly, we weren't exactly sure where the line was on the border between Tarrant and Wise. At first, we thought that was Denton, because I know.
Don't be getting us in any kind of another border institute.
Pardon?
So don't be getting us into any kind of another border.
Yeah, and so anyway, whatever it was, we looked at aerial photos, and it didn't appear to affect any people. But, and, you know, we hesitate to say, well, this is correct or not, so, but, you know, on sort of the adjustment of precincts, we can look at that if you want. Bottom line is, you're in balance. There's no requirement that you redistrict. I think your current plans comply with the law.
Any questions?
I don't have a question, I do have a request. Bob, if you would provide the thematic maps for the two other demographic categories that you have, so non-Hispanic Asian, and then a non-Hispanic other.
I'm not sure I heard all of that.
Sure. Would you provide thematic maps for the two other demographic areas that are in the chart? So the only maps that I had showed the non-Hispanic, Black, and Hispanic. And so what I'm requesting are thematic maps for Asian and for Hispanic other.
Asian and non-Hispanic other?
Mm-hmm.
Sure, we can do that.
Thank you.
Any other questions?
I don't have a question, I do have a comment. and that is that while I am satisfied with the 1.97% deviation between the existing precincts, and I recognize that because of that 1.97% deviation, it being less than 10% allowed by law and practice, that because of that, we don't have to redistrict Commissioners Court. I think that for the sake of the public's satisfaction and their ability to participate in the process of redistricting, we should at least go through the process of redistricting and solicit maps and solicit public input and decide what we're going to do after having gotten that public input.
I agree.
Okay, thank y'all. Anything else, Bob?
No.
Thank you very much, and we'll, I guess, consider this at some point and decide where we go from here.
Okay, thank you.
Thank you.
Thank you.
So, Chandler, do you want to speak to that?
Board members, just one note. By law, by November 12th, I believe it is, we have to adopt a plan if there is to be a plan. And with not having court for the next two meetings, that would significantly compress the schedule we have. The initial schedule we had our first drawing session happening on October 12th. There was going to be one public input session that Thursday in Precinct 2. The next week, there were 4 additional public input sessions that had been set up, the 18th through the 21st, one in each of the 4 precincts, followed by a second drawing session, which was to take place that following Tuesday, and then ultimately to bring an adoption of a map on November 2nd with a backup date of November 9th in case November 2nd we weren't ready. So while we can certainly look at that, we would, if we are going to move forward with this, we would need some kind of a decision today because we will have to rework that schedule based on the court schedule over the next month.
Or revise the schedule downward some because November 19th is, from memory, when filing begins for the primary elections. So you want to finish whatever you do before then.
Even though the court is not meeting for 2 weeks, I don't see how that makes the schedule that you currently have, Chandler, invalid. We can still have those community meetings, whether the court is meeting or not, and have the drawing sessions as outlined. I don't see a problem with that.
The 19th, as far as the filing goes, should the legislature still be in the middle of their process?
Right, it can move. They have a bill. I think the legislature does not want to move the filing period. They have a schedule that if they adopt plans by X date, everything stays the same. If it's a Y date, they cut off a little of the first of the filing period, but not necessarily the deadline. If it's later than that, and I don't have the dates right now in front of me, they move the filing deadline and conceivably could move the primary. You know, I suspect that the legislature is going to adopt something by early October, and I don't think they will move the filing period. They certainly may, but I don't think they will.
If the process ends up in court, then is it dependent upon whether the court issues any kind of a restraining or order, or what happened? Remind me what happened in 2011? Because we ended up in a May primary then.
The court can change the primary date and can change the filing date. Actually, going back, I'm trying to remember exactly on 2011 because it all got very complex.
I can tell you, the election was held the Tuesday after Memorial Day.
Okay.
Okay? So it was right at the end of May.
Yeah, and in fact, the ones I had up on the board, which were back in the 90s, where the Supreme Court overturned those districts, they had, and this may have been the next year or next time up, they ended up having, completely change the filing and the election schedule for those particular affected congressional districts. So they could. They certainly can do that.
If they end up pushing that back, does that impact the November 12th date for our commissioners' precincts?
Well, if they change the election date or the filing deadline before then, it certainly could.
But otherwise, then, what you're saying, Chandler, I believe, or Bob, that we are required to have whatever plan for redistricting approved by November the 12th.
Well, I don't know that there's anything that says you have to do it this way, but under current Texas law, filing begins
November
on the
15th.
19th of November and ends in December, the middle, is it the 15th or whatever the date is.
It's usually earlier than that.
I think you're gonna
November
find that
15th,
there's some cities that are going through redistricting that are not going to have to meet that timeline. I think the November 12th date was chosen because of the filing, beginning of the filing.
Right, the cities are on a later time because they don't have the March primary, they have May or maybe even November regular elections.
So Chandler, your time frame that you outlined earlier.
Yes, sir.
Was to hold public hearings or public meetings. I don't know if there'd be public hearings, but public meetings.
Yes, sir. The initial schedule was to have an initial drawing session. That would be with Bickerstaff, where they actually have the maps up real time. It would be a publicly posted meeting. It was originally scheduled to be held over at the Family Law Center, so kind of like the setup of an IT steering committee meeting, where real time we can make adjustments to maps if needed and see how that affected the numbers. That was scheduled for 2 to 5 p.m.
On what date?
On the 5th, the 12th. The 12th. There's one following the initial. Yes, sir. Yes, sir. Following the initial drawing session, we had set up a series of public input sessions to be held in each of the precincts, either at a sub-courthouse or another location for public input. We were also going to hold one of those public input sessions here in court, I believe on the 26th, if memory serves. Then,
hold on.
Yes, sir.
So that would be, you're saying October 26th would be time for public input here at the court. Do you have the dates for precincts 1, 2, 3, and 4?
I do.
What are they?
18th through the 21st is the schedule. Hold on one second. I'll pull up the exact dates here really quick.
I have my first on the 14th.
Yes, ma'am. I'm sorry. I was going to get to that. But yeah, the 14th, that's the one in Mansfield, I believe. Yes, that's the Mansfield taking place at Vernon Newsom. Then the following week, the 18th, we have the Sheriff's North Patrol Division in Lake Worth. That's for Precinct 4. The 19th is the public input session for Precinct 3 at the Northeast Sub Courthouse in the courtroom. Precinct 1 is at the Deon Bagsby Sub Courthouse. That's at 6 o'clock on the 20th. And the 21st is a public input session number 2. And the location is yet to be determined on that. We have 2 locations that have been proposed. We're just trying to finalize the availability of either one of those locations.
Now for the one on October 22nd, that's for Arlington, that's at the Dan Dipert Career and Tech Center.
Okay, thank you. Is it the 21st? I have the 21st.
21st.
Okay,
That's
thank
right.
you. Okay,
Yeah,
yes,
if I
ma'am.
said it wrong, then it's the 21st.
Okay, yes, ma'am. The following after those public input sessions had taken place, we were going to have the second drawing session on October 26th, after court in the afternoon from 2 to 5.
Well, now, you said, you mentioned that there was gonna be one in court. Is that the same day as was that the 26th also?
No, sir, that's the 19th. That's my fault.
So I want to go back over these and make
Yes, sir.
sure. So we're talking about public hearings on the 14th and the 21st in precinct 2, on the 20th in precinct 1, on the 19th in precinct 3, on the 18th in precinct 4, and on the 19th at court here?
Yes, sir, that's correct.
Okay. And so then you're also talking about another work session or drawing session on the 26th in court?
Yes, sir. Not in court. That's 2 to 5 in the afternoon at the Family Law Center.
Might I suggest a change in location for the precinct 1 public meeting?
Yes, sir.
Split the difference between my 2 sub-courthouses and have it at the Resource Connection, which is essentially halfway between the 2.
Be happy to make that change, sir.
Okay, so that puts us then, if we're going under that schedule, that gives each precinct an opportunity to have a public hearing. Precinct 2 has 2 scheduled. Then we also have the one here at the courthouse on October the 19th. And then we have the final, or we have a public drawing or drawing of the lines deal on the 26th. And then any additional, and then you're looking for some sort of an action. What are we doing in court?
November 2nd would be the first chance to approve the plan. November 9th is the backup date if for some reason we cannot make the 2nd.
And what's the date for the precinct 3?
19th.
19th, yep, that's right.
And
That's in the court.
And what time is that one in comparison to the one here on the same day?
The one here is during court. It's just it'll be a time during court. All of the evening sessions are from 6 to 8 p.m. or whenever we successfully answer any questions or comments that individuals
so
have.
The one here
It's in court.
is in court.
Yes, sir. Now, this was all originally predicated on the fact that we believe we were going to have court on the 12th. Now that we're not having court on the 12th, we have some decisions to make. We can either try to shift everything by 1 week and we lose our November 2nd date and fall back on November 9th as our date, or we could try to do something we could either do one public drawing session and leave all of the public input sessions in place. But the original.
Is there any reason why we can't still have the public drawing session on October the 12th, and we're just not here? Or whoever's here is here, and whoever's not is not?
I don't think it has to be a publicly posted meeting necessarily. So it could just be a public input session that does not have a quorum of the court present.
And so,
And one thing, on some of the things that we had talked about, is one of the initial items was to have a drawing session to come up with a preliminary plan and for us to come up with a preliminary plan. What you would probably do, if the question is, should we redistrict, the preliminary plan, I imagine, would be the one that's already here, rather than, because the idea is to draw something that's in balance and let people start commenting on that, but you may want them to comment on.
well, I think that's a good point. So what you're saying is the October 12th meeting would be taking the current map and saying, we're in balance. Do we, and anybody that wants to make suggestions on how that might be tweaked could make suggestions at that point. And I guess, as a court, we need to maybe take official action as to whether we're gonna go forward or whether we're going to just say we're done and it's over with.
If we make a decision not to redistrict, because we're in balance, does that take an action of the Commissioners Court?
I don't know that it actually would, because if you're not doing anything.
Do we have to,
Now,
do we have to submit anything to either Justice or?
no. No.
So what was
But
sent
you
to us-
certainly can make a decision, and at least one other county that was in balance made, said, okay, we're not gonna do it.
So then, Bob, so for those draft orders that was sent to us, that was if we were to make changes, only in the case of, that we were gonna make changes? The draft orders that were in the attachment, were those orders only necessary if we chose to make changes?
That was my well, yes, in that it says, in redistricting, here's the criteria we're going to follow. If you decide to have hearings and ask people for input and so forth, it would be helpful to go ahead and adopt those anyway, because it tells people, if you're going to give us a map, number one, here are the criteria we're going to look at, and number two, if you're going to give us a map, we would like you to do these things, one of which is show the entire county, not just a single district or commissioner precinct. And, while you obviously will look at something if somebody comes in with, say, we want to make this change in this precinct, it's always helpful to have the entire map before, because whatever you do to one district affects the other
Sure,
three.
so you can see it in context.
Yeah.
Sure.
So if you're asking people to submit maps and so forth, you probably ought to adopt those two resolutions.
Any thoughts, comments?
So,
To be very honest, I don't have a dog in this hunt.
yeah, I understand. I think for us to make a decision that we're not going to redistrict would not be good public policy. I think we need to go through the process. Even if we end up in the same place, we need to go through the process and give people a chance to have input. So, I'm going to try to offer a motion and see where everybody is. And it's going to be a multi-part motion. First, that we redistrict. Second, that we adopt the schedule that Chandler has presented. Third, that we adopt the two resolutions that Bob Heath presented that give us guidelines for the process. That's my motion.
Second.
Okay, we have a motion and a second. The one question that I have about the two things that you said, Bob, were if somebody wants to just simply, if they don't have all of the computer and all that stuff to be able to submit a map, how are they going to be allowed to input into, I think this little neighborhood needs to be connected with this neighborhood and blah, blah, blah?
No, I think those are things you definitely listen to and you let people say, but as a practical matter, if somebody wants to give you a map, they need to give everything.
Okay, so what you're saying is that an individual that would come to one of these meetings might say, I really believe that this particular precinct, neighborhood, area needs to be with this, in this particular precinct versus in that particular precinct.
Right.
And that would just simply be a comment that would be recorded, and what's gonna end up happening with that comment?
It'll be before the Commissioners Court, and the Commissioners Court can consider that and rejected or accepted.
Okay, and then with regards to anybody who gives a map, then they would look at the overall, we would be looking at the overall map and the information. I'm assuming that the two recommendations you're making detail exactly what that map is to delineate.
Yes, and I would have to go back and look, but basically it says, you know, they need to be in balance, and, you know, that we would like you to show the racial and ethnic breakdown. One thing you might want to, I mean, this is entirely up to the Commissioner's Court, and I'm not going to tell you one way or the other on what you ought to do, because y'all have the election certificate, I don't. On the schedule, you might want to leave it somewhat flexible, just because it may end up looking a little different if we're starting with the existing map and seeing if we want to change. You know, you might not want quite as many hearings. You may do. I'm happy to be here whenever you want me to, or have somebody from the firm here, depending on, you know, we'll do that, and we'll do what the county wants. But, you know, logistically, I know when we were working this out, sometimes things changed back and forth simply because of Commissioners' Court meetings and commissioners' availability and stuff like that.
And also the state's redistricting process, so. Said also the state's redistricting process in their hearings, which.
Yeah, I mean, that
some
could
of us are
have
present for.
an impact. Again, I think they're going to finish within a couple of weeks, but because I suspect the votes are there to adopt whatever they want to, whatever the majority wants to.
Yeah, my point was mainly for any of us that have to attend those hearings in person.
Sure.
That could affect our availability for things here.
Absolutely.
Yeah.
So right now, as I see it, we have 8 opportunities for the public to give input.
Yes, sir.
And so I think what Bob was saying is that too many or too, you know?
And in the order that's in your book, there's not a schedule in that, because that'll give you flexibility if we need to modify that. And we're not asking you to adhere to that schedule. You know, don't set it in stone. We can go ahead and change it if we need to.
So then are you amenable to that? Because you would have to amend your motion, I believe.
I will amend my motion to adopt the schedule as a guideline, a flexible guideline.
I will hold my second, or I will keep my second.
Okay, so we have a motion and a second. Any further discussion? Please vote. Commissioner Johnson?
No.
The vote would be 4 for, 1 against.
One additional point of clarification or direction from the court. We've talked about the 4 commissioner precincts. We have not made a decision on JP or constable precincts. Is that something you would like us to pursue at this time as well, or is that something we would like to hold for a later time?
My hope on that would be that we would hold that for a later time.
I'll make that motion.
I'll second.
We have a motion and a second to hold on the redistricting of the JP and constables. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Judge and Commissioners.
Okay.
Thank you very much.
Thank you. If we
I've
could take
got
about
one more
a-
thing, sorry. In the draft orders, my name is spelled incorrectly, so if.
Yes, we updated that, ma'am. We fixed that. Apologies for that.
Thank you.
Okay, if we could take about a 5-minute break. Mr. Manius, moving right along.
Thank you. If we can now go to item number 4, under the administrator section, we're requesting that the court adopt a resolution which would nominate up to 5 candidates for positions on the Tarrant Appraisal District's Board of Directors. And on your court communication, we've listed the 5 members that are currently there, plus the tax assessor collector is also a member of that board. Just for reference, and I believe I sent you some information on this last week. Last time, which was 2 years ago, this court nominated Catherine Wildman and also Michael Gaspey as our candidates. As I said, you can nominate up to 5. You do not have to nominate 5, but you cannot nominate any more than 5. Also like to point out, and I think it's covered in the court communication and in the memo that was sent to you, when you look at the calendar for how all of this is going to be moving forward, the legislature in this last session basically changed the law, that the tax code, so that whenever we receive the official ballot from the chief appraiser, we have 2 court meetings to cast our votes, because our votes consist of at least 5% of the total votes. There are some entities that have lesser votes, and they don't have to meet that timeline. We do. Anticipating that the final ballot will come out on October 30th, we'll have until November 12th to submit our candidate, or our casting of votes by resolution. So, members of the court, if you desire to go ahead and make some nominees or nominations to the board, we will put that in an order, and we'll ask you to pass that order today.
Judge, I would like to nominate Mr. Jim Austin.
Okay, and I'd like to nominate Jim Griffin as well as Catherine Wallman. Are there any other nominations? Okay, then
we're going to ask that you approve a resolution making the Tarrant County Commissioners Court nominees being Jim Austin, Jim Griffin, and Catherine Wildman.
So moved.
Second.
a motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Members of Court, on item number 5, we're requesting that the Commissioners Court approve an order prohibiting outside burning within the unincorporated areas of Tarrant County for a period of 90 days from this date or until repealed by the court, as in accordance with state law.
Move for approval.
Second.
We have a motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Members of the Court, on item number 6, we're requesting that the Commissioners Court approve an interlocal agreement between Tarrant County and the University of North Texas Health Science Center for the Accelerator Services Program.
Move approval.
Second.
We have a motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Members of the Court, on item number 7, we're requesting that the court approve an agreement for medical examiner services between Tarrant County and Dr. Nizam Pirwani.
Move approval.
Second.
We have a motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And then finally, number 8, we're requesting that the Commissioners Court approve the county's holiday season schedule for 2021 as stated in your court communication.
Move for approval. Second.
We have a motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
I'm sorry, we do have one additional one. If we can go to item number 10. We're going to take up item number 9 whenever we come back from closed. Number 10, we're requesting that the Commissioners Court approve an agreement with Legal Aid of Northwest Texas for the Tarrant County Eviction Prevention Assistance Program.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Ms. Tidwell?
We have one item for the court to consider today, and that is the release of the $28,396,000 of collateral and accept the substitutions as outlined in your court communique.
Move for approval. Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Helen?
Hello. We have several items. I'll present the first, and Candace will come up and present the remaining. We are requesting authorization, approval of our FY22 special purpose budgets.
Say again?
Our FY22 special purpose budgets.
Move approval.
Second.
We have a motion and a second. Again, as we go through here, do we attempt to spend the money out of here as much as we can in any given year?
The answer to that is yes.
So I know one of the things that we have in here is the economic development, and I asked this question last week, or I've asked the question of a couple of people. Is that money going to be able to be spent? I know also in the course of looking at the ARPA, we've talked about some economic development projects. Is there any reason why we could not spend the money out of here as opposed to spending ARPA money?
There is not. We received more this year than we had from the auditors for the revenue. Currently, it's an undesignated, but we can move that money of where the court decides it needs to go.
And so by approving these special budgets, it does not prevent us from doing that?
No, sir. We can make an appropriation adjustment every Tuesday like we do with any other and make it available to whatever line or program you want to make available for.
Just want to be sure about that. Thank you. Any other? Yes, sir.
And Your Honor, we do have at least one, possibly two programs we're going to ask you to consider to fund out of that particular
Good.
deal.
Good, thank you. Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Now it's Candace.
And here's Candace.
Good morning, Judge and Commissioners.
Good morning.
We are asking for interim funding for up to 90 days for items 2 through 5. We typically receive our notice of award from the state in November.
Move approval.
Second.
We have a motion and a second to approve items 2 through 5.
Yes, sir.
Any discussion?
Done.
Please vote. Commissioner Johnson?
Yes.
Motion passes
Thank
unanimously.
you.
Thank you. Ms. Glenn, Tina?
Move to receive and file personnel agenda.
Second.
We have a motion and a second to receive and file the personnel agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Good afternoon and thank you. So I'm going to pass out just some information before I get into our second item. And I'm going to get in trouble with GK for doing this, but I'm going to push this up a little bit.
Good morning. Thank you.
I have mine, thank you.
So on item 2, as I said, I want to go through just a couple of data points before we have discussion about the proposal that we're bringing to you today with regard to an employee vaccination incentive program. So what I wanted to do was, again, just start by giving you some information on expenditures and other information related to COVID and how it's impact Tarrant County's workplace. So we have the information broken down into different subsets for you. First, in our workers' comp area, and of course, these would be COVID claims where the exposures occurred at work. What we paid to date is around $1.3 million, and that would include medical spent, what we call indemnity claims, which would be time lost from work to cover that time, to cover that money that was lost. So that's what we've paid to date. You'll see the next information that we have there for you is the $6.9 million. That represents what we've actually incurred, again, in the way of payments, and then what we're projecting into the future. So what it will actually cost to cover the claims from the initial onset through final treatment. A big portion of what's going to be represented in the $6.9 million will be survivor benefits that we'll pay for in those deaths that we've had where there were surviving spouses. Those individuals by law receive weekly indemnity payments for the balance of their lives. And then if there are dependent children who survive the deceased employee, then those individuals receive weekly payments until they graduate high school or until they graduate college, if they choose to go to college. So, and you'll see we also have provided you with a number of fatalities thus far. And so far we've had 3, all in the Sheriff's Department. And then in total we've had 200, again, this is workers' comp, 298 claims related to COVID. The next set of information there will be actually their total deaths. We've had 8 that across the county that we've been able to identify that are COVID related or related to COVID and its complications. And of course, we've identified for you there the departments that were impacted by those deaths. The next set of data, this is information that we received from United Healthcare, and this is information as of September the 27th. You can see that we have it broken, or they have it broken out by what we spent in vaccines, testing, and just medical claims. So you see for vaccines for 20 and 21, we spent a total of $80,213 for testing, over $500,000 we've spent for testing. And then for medical claims, meaning hospital stays, outpatient treatment, we've paid right at $4.3 million for a total of $4.9, so almost $5 million. I want to remind the court with United Healthcare, the court has again been very generous and has been covering all employee out-of-pocket costs. So when employees are hospitalized because of COVID, then where they would normally have deductibles and co-insurance, possibly have deductibles and co-insurance, employees are not being charged for those expenses. So our plan has been picking all of those items up, expenses up, and we will be doing that through October 17th. And so after October 17th, at the board level, we'll be talking about whether or not we wish to continue waiving those costs for employees and their dependents, or if we want to make a different decision. So again, that's been a very generous decision that the court has made. And then finally, the final data set that you have are just vaccinations. And this information is current as of this morning, according to, and this again is United Healthcare, so these vaccinations would be represented at CV, for example, CVS locations, or if vaccinations have been given in doctor's offices. So fully vaccinated so far, as of this morning, 1,836. Partially vaccinated, 283.
How many total employees would you estimate that we have in Tarrant County right now?
I believe around 4,300. So, and obviously that's a moving target.
So we're somewhat close to 50% that have at least begun the process or completed the process.
So again, these numbers, I think, help us see what's happening just in terms of money spent. What I think they don't represent is the emotional toll that COVID has taken on the workplace, on our departments, on all of us. Obviously, when we have employees who have been diagnosed with COVID or have had a COVID exposure, their quarantine might be appropriate, which of course then impacts departmental operations, depending upon the number of employees who are determined that need to quarantine, perhaps because of an exposure to an infected coworker. So it's been tough. It's been tough on all departments. I'm not telling you anything that you don't know. We have deployed the use of our employee assistance program with the recent deaths that we've had and previous deaths. So we typically will reach out to departments and ask if they'd like to have an EAP representative come and visit with staff. And so some departments have taken us up on that. So I'm saying all of that then to take you to the proposal that we have for you today.
Before you move on to the proposal.
Yes, ma'am.
Just some clarifications on the numbers you presented. So for the workers' comp claims to date, the 298, that would be, that represents like unique people, right? Not a claim.
Yes, ma'am.
Okay. And then for the UHC claim summary, it says the 1,319 confirmed cases, including 819 employees and retirees. So is the difference between the 819 and the 1319, is that dependent?
Yes, ma'am.
Okay. And then for the vaccinations, that would be the number that someone is willing to report, right? They would have to be willing to report that they're vaccinated.
Well, so these numbers would reflect all claims submitted to United Healthcare.
For a vaccine?
For vaccination.
Gotcha. Okay.
Yes, ma'am.
Okay, thank you.
And this does not take into account overtime or anything else that outside of the workers' comp?
Yes, that's correct.
That would have been an extra cost to the county.
That's absolutely correct.
County or taxpayers have had to pay.
Yes.
You're
Yes,
saying
sir.
like if someone was like out of work and then it caused overtime for other employees? Okay.
Yeah, because, for example, our sheriff's department has been working 6 days a week.
6 days a week.
Right.
So that's 48, so that's 8 hours of overtime, primarily due to the fact that they've had people out.
Understood.
Tina,
Yes, sir.
are any of these costs eligible for CARE funds or the ARPA funds or reimbursement?
That would be a Helen or Russell question.
And why would they not be?
I see Russell coming forward.
Good afternoon. We believe that some of these costs may be eligible for certain forms of federal reimbursement, but as we're working through these various issues, we'll be coming back to court as we do work through some of these issues.
It's been going on a year and a half. Y'all haven't figured that out yet? What have you been doing?
Certain claims would fall under certain types of funding options. And so there's more analysis that we need to do in order to figure this out.
Do you know, are other governmental entities reimbursing with those type of funds, their medical costs?
I'm not for sure. Medical costs after March the 3rd of 2021 are very likely eligible under FRF.
But that's the ARPA money prior
Correct.
to March, so anything in 2020
it's a little bit, it's quite complicated.
Okay.
Like COVID didn't happen then?
Like the government said we couldn't use the money for that.
I would like to remind the court that earlier today, you all voted upon our recommendation to add 3 of our officers to the memorial, law enforcement memorial, and all 3 of them passed because of COVID. So it's dollars, but it's also lives.
Now, and this may be what you're fixing to get into, Tina, but I know in looking at your recommendation, you're recommending time off. Have you looked at other counties, and are you gonna give us some information related? I know that a couple of the counties in the state have done something. I know a couple of employers that, at least I've heard, have done, it's carrot, stick, whatever. Are you gonna talk a little
I can if you like.
I'd like for you to.
Okay. So, yes, we've had ongoing discussions for the past couple of weeks. We've had at the table representatives from the administrator's office, from HR, from audit, from budget, and somebody will tell me if I'm missing anyone. And so what we've done, Judge, is we have taken a look at what other agencies have discussed and ultimately approved. And that's run the gamut from gift cards, to cash. One agency provided a rebate where they would reimburse employees who had medical coverage some portion of their premium. And so there are a variety of different incentives that are being implemented. Some of the challenges that we ran into as we went through some of these different options and talked about what might work for us. As you said, were we interested in the carrot or the stick, right? So do we want to try to encourage employees in one with a carrot versus a stick? We also had quite a bit of discussion about whatever it is that we presented. We wanted to make sure that those employees who had already been vaccinated could be rewarded, and not just those who had not been vaccinated and would be vaccinated in the future. So that was a big sticking point. And just to be honest, just the administrative burden that would be required perhaps to implement some of the items that some of the other agencies implemented. And of course, in the background always is how quickly we want to get this done and what can we do, what can we present that would not be too administratively complicated, burdensome, and we could deploy fairly quickly. So all of those things went into our conversation. Legal, I think I left the criminal district attorneys off. They were at the table during those discussions as well. And so what we have today, as you just made mention of, are 2 options for the court to consider as incentives for employees who have not yet been, for employees to become fully vaccinated. These options would enable employees who have already been vaccinated to receive a reward as well. So you have 2 options as outlined in your court communique. The first option would be to award 40 hours of paid leave to employees who are fully vaccinated and who provide proof of full vaccination by November 19th. And let me just take a step back. By employees, we're referring to regular full-time employees. Project employees, you recall project employees are temporary employees. However, they have all of they're full-time. They receive all benefits that the rest of us receive with the exception of retirement. So that's project employees, and then we would also be recommending an award to part-time employees, which again are temporary employees. They just have a reduced work schedule. And so their reward would be consistent with their weekly work hours. So that would be option 1. Option 2 would also be an award of additional leave time But option 2 would be 24 hours, the same caveats that I just addressed. We'd be looking at a prorated number of hours for our part-time employees. In this proposal, the leave would be awarded once HR has had an opportunity to, or has received all of the documentation. We would prepare that, we would put that together. And so we would have employees, and our Vision employees would submit the documentation, proof of their full vaccination, again, by November 19th, and then we would award time in December. So the November 19th date will be a little bit of a challenge, only because we'll be in the process of annual enrollment that typically wraps up the middle part of November. But I think with the court's agreement to provide us with maybe one additional resource, I think that we can get it done and get it done timely. One additional data point that's important with either option is that there would not be an expiration date for the use of the time. However, employees would not be paid for any of this leave at the time of separation. So employees would certainly need to use it, but we would not tag this leave with an expiration date. So that's been what we've been talking about, or that I think summarizes what we've been talking about and are presenting to you today. And of course, we'll take questions if you have questions.
Well, I always lean toward carrots rather than sticks, incentivizing people to do something rather than forcing them to do that same thing. I think options 1 and 2 meet that criteria. I would be in favor of option 1, and I'll make a motion that we approve option 1 and see if I can get a second.
I think, and maybe I'm wrong, but is option 1, are they both considered to be part of the plan where option 1 gives you more hours if you get it done by November the 19th, and then
Option 2 is the same, except
it's just 24 hours versus 40
Yes, sir.
hours?
Same date, November 19th. That's the date.
Okay.
A second, and a question, and I know you said that obviously the DA's office you work closely with the DA's office on this, so even if we were to approve this and to grant it, would this still be subject to the same supervisory, process that?
Absolutely.
that all the other time off requests?
Yes, ma'am.
Okay.
And we've noted that in the court communique, and we'll note that in whatever communication goes out to employees if this is approved, that being this leave, just like any other leave, whether it's sick leave, personal vacation, is always subject to the approval of the appointing authority or that individual's designee.
And I guess that's one of the things that I would like to hear a little bit from, because we've got the sheriff's department
Yes.
working 6 8-hour shifts right now, so how are they gonna give their people off? And I'd like to hear from some of the other department heads, because I think we're setting, okay, here's the expectation, but oh, by the way, I'm not sure we're gonna be able to give you the hours off because we gotta have you here at work.
I'm having enough trouble getting my people to work at maintenance and at the office. And give it another 40 hours, just all it does is make that problem worse.
And again, Commissioner Brooks, I agree with you. I would much rather do an incentive. But at the same time, we're looking here at estimated costs of somewhere near $13 to $14 million that we probably will have incurred to this point in time. and only half of our people may have been vaccinated. And I think at some point in time, we've got to say, okay, we'll cover costs for people who are vaccinated, but not people who aren't. Or certainly, we're going to put them back into the mode of them having to pay for that. Or I know that, I believe some of the companies, and I don't know if any of our other PEBC meetings, members, I know that Delta is charging a $200 a month, maybe United United is just saying, you're gonna get the vaccine or you're fired. I believe that Delta is saying it's gonna be a $200 a month surcharge.
That's correct.
And that may be, in my mind, and I know I've had a lot of comments about, well, we're gonna pay somebody to go out and get something they should already have gotten. Well, if I can and I think it was Bear County that was offering the $1,000.
Up to $1,000.
Up to $1,000 in premium reduction.
Yes, sir.
So in our scenario, if every employee got that, then of course, there's only about 3,000 of them that may be in our benefit plan. But if they got that, that would be 300,000, and we've spent $12 million thus far. So, for that says I'm gonna spend $1 and maybe save close to 10, 15, maybe $20.
And everything that's being discussed is exactly what the group has been discussing, right? The back and forth, the pros and cons, the carrot, the stick. Personally, I was sort of pulled towards I was leaning towards the surcharge. That is a stick. That's a stick, which basically says if you're not vaccinated, then you pay an additional, whatever it is, whatever the court would designate in the way of insurance premiums. But
we're going to come back here on October the 19th.
Yes.
And we're going to be asked whether we're going to continue the policy of paying 100% of COVID-related costs. And again, at that point, and I'll say it again at that point, is I'm going to have problems paying 100% of the cost if the individual is not chosen to go out and get the vaccine. And I just believe that at some point in time, we've got to shift from, we want you to get it, we're going to give you time off, we're going to pay 100% of the cost to, okay, you had an opportunity, the vaccine's been out here long enough, if you hadn't got it, you're going to pay for the cost related to COVID. Or you're at least going to go back to paying for the deductible and any out-of-pocket expenses that you would have otherwise paid for in the normal course of business.
Yeah, and what United Healthcare has shared with us, Judge, when we've been on our board meeting calls, is just that. Many of their clients have already moved past the plan covering those expenses. And so I think we're part of a shrinking group in that we're still covering those costs for our employees, but many of the health plans have already moved away from it. So again, it is something that we discuss quarterly, and then of course we come back to the court with the recommendation from the board.
That'll be our next meeting.
Whenever we have our next meeting, yes, sir.
So what are some of the other department heads? I mean, do you have thoughts, or if you wish to voice them, come forward and do so? Just because you're the ones that are going to suffer under, or potentially may suffer under giving the additional time off, or I guess you simply say you can't have it because we can't afford to lose you right now.
The only thing I would add is I still have hope that someday this goes away a little bit more than it has in the past. And the time is available for people to use, even if they're not allowed to use it right now. Many of them wind up not using all their leave that they already have, and if they don't use it, it doesn't cost the county anything unless they get a payout, but we excluded it from the payout. So if they're not allowed to use it, there is no cost. And I do understand the Sheriff's Department is your classic example of where people are not going to really be able to use it right now. But I still think that if I were an employee, a lot of newer hires are low in need, and this might be a real incentive to them
Well, but if I'm an individual, aren't they going to, they're gonna use this leave first because they know they'll get paid out vacation, as opposed to saying if we're gonna give them the extra, it's got to be, they can use that after they've used all their other leave. They'll have an extra 2 weeks. So then realistically, we won't get to the end and them have to be paid out that amount. Did anybody understand that?
I understood what you were saying. The only thing I'd say to that is sometimes a lot of our employees are really smart on how to use their leave, and then there are other people that wind up with just way more leave than they can use when they terminate even after they've been here for years. So it's really hard to say what the cost of this will be in the long term. It's really, to me, it's more a decision on if the court feels that the incentive is worth trying to get people to get the vaccine. This is a more effective cost, regardless of what it is, as you point out. It's a much more effective way of trying to incentivize people to take the vaccine, because the time off is not a guarantee. It's not an out of pocket to the county of putting cash or some immediate reward in their pocket. So whether they use this or not is, again.
And please note that this will not impact elected officials, because elected officials do not accrue vacation, time off, or anything.
So what about the caveat on the elected official salaries about the up to $1,000 incentive? That wouldn't be part of this either, right?
That was simply a
Placeholder?
placeholder that was put in there to, if the decision was made to reduce premiums, then, well, I'm not even sure if the decision was made just to reduce premiums, I don't think that would have affected
The reason
it.
that was put in there for twofold. First of all, at that point, we didn't know if the Commissioners Court.
Can't hear you.
Yeah, and I know why it was put in there. I'm trying to understand right now, what impact do the decisions today make on that? If any.
Under the current motion, it would make no impact whatsoever.
That's correct.
So Tina, I'm asking this question certainly not to discredit any and all the work that's been done to get us to this point, but have employees, whether through an informal survey or poll or anything like that, have we asked our employees what would be a meaningful incentive for them, and was this part of that feedback?
There wasn't any formal outreach to employees to ask, what they value most. Again, the conversations that were had by the representatives from departments that were mentioned earlier. With all of everything that was said has been said here today is what was said in our group. Again, trying to weigh the pros and cons of each proposal, what employees might find attractive. I know we all had some anecdotes just from talking to employees that we know are not vaccinated. So what would get you, what would cause you to want to be vaccinated? As I described it, what do we think will move the needle? And I think we all decided that for everybody it's different. To Renee's point, I can't really do anything with any additional leave. I have leave right now that I won't ever be able to use or get paid for. But that's me, right? Someone who's a newer employee, someone who has had maybe, a family medical leave situation, may not have any time. Once upon a time, I had 2 babies and I didn't have time. So this would have been attractive to me then. My baby's 19 years old, and so, I've accrued time. So every case is different. So again, we didn't do any formal polling, but we certainly did talk amongst ourselves about employees that we have in our respective departments who are not vaccinated and what might entice them to be vaccinated. So for everybody, the answer is different.
Yeah. Well, and I didn't ask that question with the answer in mind, but I'm not surprised by what you shared, and even in my confidential conversations with some department heads, I didn't talk to all of them just to ask. It pretty much speaks to what you all found.
Yeah, it was a struggle.
So is there for the The leave time awarded once HR has been provided proof of the COVID vaccine, but no later than December 2021. Why did we pick that date? Just because it's,
It was just arbitrary. I mean, I think for us, again, with, since we're going to be doing the processing, we're going to take the lead on processing, we do have to get past enrollment. And so I think we were just trying to give ourselves a little bit of cushion, so that we wouldn't be too overly optimistic with the completion date when we have other processing that we are responsible for.
because I was trying to think what's a reasonable amount of time for us to see, like, if this is working and how well it's working. I don't know.
Well, and what we've seen, Commissioner, with some of the other proposals that we've reviewed by other agencies, which made perfect sense to me, it was really, there was a push to get the vaccinations now versus later, right? And so, and we had discussion, we don't want to push the, November 19th date out too far, because that defeats the whole purpose. If we want employees who are not vaccinated to be vaccinated, we want that done, we'd like for them to get vaccinated sooner rather than later. I mean, I think it's always effective if the vaccination occurs, but I think we had a sense of urgency that if we were going to offer an incentive, we wanted to incentivize the employee to do it now and not wait until later. And then I think there was discussion about the holidays. I'm remembering conversations. As Vinnie mentioned earlier, oftentimes when we congregate around the holidays is when we start to see the uptick in COVID cases. So I'm just remembering that part of the conversation as well.
That was one of the primary reasons we chose November 19th, is to prepare people for the Thanksgiving and Christmas holidays.
And again, we've had a number of calls about, okay, we're using taxpayer dollars to pay the incentives. Again, I look at it from a standpoint, if I pay $1 but save $10 or $15, then that's a good use. If you truly don't want, if your philosophy is we don't want to pay taxpayer dollars, then that makes the surcharge truly one that costs the employee who's chosen not to be vaccinated. I believe that the numbers show that if you've gotten vaccinated, it's going to reduce the cost, even if you subsequently get COVID. And so that would still be saving taxpayer dollars by getting someone vaccinated, and if they choose to not get vaccinated, they'll pay the extra $200 a month, and then next time we meet, we'll determine whether or not they have to pay out-of-pocket costs, deductibles, or all costs associated with the COVID illness. But and again, I'm not opposed to trying an incentive for a little bit longer, but I'm losing patience, I guess, with offering the incentive, which to me was the fact that we said we'd give you the shots. I'm a little I'm trying to figure out a little bit how the 80,000 number for the cost of the vaccines, I guess that's the administrative fee we've paid for.
Yes, I don't know that we're being billed for the serum yet. I think that's still.
It's not the serum's not.
It's still, that's
They
still.
bill our insurance.
Yeah.
And really, if you go down to the pharmacy and get and they're going to
They're
ask you.
billing it, and they're going to bill our insurance.
Just a note, we were just made aware that CSCD, if we go with option 1, they're also going to be participating in this program.
So I'm trying to think through the timeline of us taking action if we take action today on option 1 or option 2, and then in October, PEVC has the board meeting, there will be action related to the percentage of costs, out-of-pocket costs, right? So that currently ends on October 17th. When is the PEVC meeting?
Well, and again, if someone's from our staff, they better come and correct me if I'm mistaken. So we typically have our board meetings the 3rd Wednesday of every month. And so typically we are asked, the 3 of us, about our availability for a board meeting. Of course, we can only meet if we have a quorum. And so I don't know that I've been asked about October. Maybe you have, Commissioner Fickus, or you, Judge Whitley?
I believe we're having a meeting.
Okay. Does anybody know anything different?
Let me look.
I'm sorry, what did Amber say?
She said that she knows that, I guess the plan is for us to meet in November, and have we gotten a cancellation for October? Okay.
I show a meeting on November the 17th, but I do not show a meeting on
In October.
October the 20th.
What staff explained to me, because.
I don't either.
Yeah, apparently we have kind of had gaps in the waiving of the co-pays and the co-insurance. And so when we had a meeting and made a decision, then it was just, the decision was applied retroactively, which of course didn't harm the employee because the county continued to
But
pick
if
up the
we-
cost.
But if we were to decide to not waive those costs, that would not affect this particular deal, because that would just be costs.
Oh, the time? No,
Yeah,
no,
I mean, it would just
no.
be
No.
concerned with future costs.
Right, but so what I'm thinking through is how to maximize the time if we decide to incentivize, how do we maximize the time that we incentivize, and then, you know, I don't like using that analogy that we keep saying, but, and then how do we, I'm just trying to think through what the process would be if I were an employee who was yet unvaccinated, or even if I was, just trying to think through what would that timeline look like? That's all I'm doing. I was not.
Well, if we were gonna put a surcharge on, I would suggest that the surcharge would start January 1st, and that you would have to prove up the fact that you've been vaccinated through our benefits department, and if you didn't, then there would be a $200 a month surcharge on your premiums. And that would begin January 1st, so that gives everybody time to get the vaccine done by then. And then I think on October the 19th, if we decide that, okay, we are going to discontinue the policy of paying 100% of COVID costs for unvaccinated employees, then again, they're gonna have to, and we might do it as of a certain date. It could be January 1st, it could be December, it could be whenever, but it's still gonna require those folks who are vaccinated to prove that to the benefits area. And if you don't get in there to do it, you get the surcharge, or you get to pay the co-pays and the other out-of-pocket costs, which you would normally have paid had we not done that.
I would not be opposed to what you just said.
Either, I mean, that's, yeah.
Okay? We got a motion on the floor right now. So are you withdrawing that motion?
Nope. I
Okay.
don't see them as mutually exclusive.
Okay.
We
I don't
try,
either, yeah.
we try incentives until we decide to go the other way.
Okay, so then the motion that we currently have on the floor, is it for option 1 or option 2?
One,
It's option 1.
What's the cost of that option?
Don't know
I
right
don't
now.
know.
It's
That
not,
It will be a little difficult, because if you've got somebody, and I'm gonna ask the other department heads that might wanna make a comment to come up before we actually vote. But the problem with that is we know we've got the sheriff's department working overtime right now. So, yeah, get
Yeah.
ready to move on up here.
which is why we didn't put an expiration date on it, right? So we know that that's going to be a challenge for some departments.
So is the other leave, though, that we provided.
Wendy?
Morning.
Good afternoon.
Afternoon.
Yes. Good to be with you today. Did want to say thank you so much, because the court has been very generous to the employees of the county for the last 2 years. We started this in 2020 and 2021, and you were very generous in providing 2 weeks of time away from the office for if they were impacted personally or if they needed to care for someone in their family that had COVID. I personally have urged my staff to get vaccinated on a regular basis, as you guys have as well. And I remind them to think about themselves, their family, but also care for those that you work around, care for those that you are around in the community. And some people will just choose not to get vaccinated, and it is their personal choice. I understand that. However, I chose to be fully vaccinated as early as possible because I care about the people that I work with every day, that I'm around with in the community. So I made that personal decision for myself based on my relationships that I have with my customers, with the community, with those of you that I work with closely. From a management perspective, it's difficult to estimate staffing costs and how we will react to this because I can't ask someone, have you been fully vaccinated? Because I can't do that. And I know that HR, they can notify HR that they have, and they note on their time card if it's COVID, if it's PRSL, all of the different acronyms that we love to use in the county. We note it that way. But from a management and staffing perspective, it is very difficult to make sure that, and we have offices of various sizes. And Commissioner Brooks has an exact example between his offices, polar opposites, very small, very large. However, they tend to serve about the same number of people. And if I have too few people that are available to work in the Miller Avenue branch, then I have to close it down. And I have had to close tax offices down because we do not have the staffing that's available. Or we don't have enough people to move from other branches because that's always an option too. We send people from downtown to branches all the time, but we don't know until that morning at 7:45, 8 o'clock when a manager is notified that I won't be there. Oh, and I probably won't be there for 2 weeks. We'll see what the test says. But we've also had individuals that have tested early and had a negative and tested 3 days later and had a positive. So you have been very generous in this. I appreciate it. I have encouraged my staff to get vaccinated, but from a management perspective, it is very difficult to plan on a day-to-day or a weekly basis on how we're going to handle this. And if we, and you will decide if it's an additional 40 hours, 24 hours off, but if that never expires, it goes quite some time. And I have individuals that are on both ends of the realm. Some have 0.2 hours in their bucket leave, and some have 2,000. And that's also very difficult to deal with when you have an individual that retires, and we've had a lot of retirements lately. So I simply wanted to say thank you so much. I appreciate the complexity of this issue for you in making a decision in the many different realms that you're looking at, and I do appreciate you thinking about the different realms that you could utilize. But from a management perspective, the time off is very, very difficult. Thank you, sir.
Thank you.
I'd just like to point out to Wendy that the thing about this time off is that it gives you ultimate planning authority. Your staff cannot take this leave unless you plan it into the work schedule. It's not something that they wake up in the morning and say, oh, I'm going to take this leave. No. You have to plan for them to be able to take it.
Yes, sir. Thank you. And unfortunately, I do combine that with additional FMLs that are called in on a regular basis, and I can't plan for those, as well as illnesses by the individual or the children that they care for. And so it's you and I deal with the same thing, sir. It is very difficult, and you stated it earlier. It's difficult to, and Commissioner Figgis said, it's hard to get people in, and I just really need people sitting in chairs providing service with a smile to over 2 million people in Tarrant County. Thank you, sir. I appreciate your comments.
Judge, Commissioners, good afternoon. And the Sheriff's Office and the Sheriff is a strong proponent of vaccines, and we have encouraged the employees over and over to please get vaccinated. I'm sure we're still in that same percentage of around 50% across the county. I wish it was more. We are obviously currently in a staffing crisis, but I appreciate what Commissioner Brooks said in regards to this incentive of the extra time off. It doesn't have an expiration date. And even though for the next year and a half maybe, however long this pandemic runs, we may not be able to afford them to have that time off at that point in time, but they will have it at some point in time. And so I do think it's an incentive. I do appreciate the work that's gone into this. Staffing and scheduling is a critical time for all of us, at this point in time. But I do think with the flexibility, like the auditor said, of it not expiring, that's key. So, thank you.
Anyone else?
Thank you, Chief.
We were going to mark this time in history if you had not gotten to speak.
Mary Louise thinks we're debating where she wants to go last. Well, I appreciate the court's willingness to allow the elected officials to have some say. That doesn't happen in other counties. Being on the board of directors of our state association, I hear about what goes on in other counties. So we appreciate it here. I would just say that as a matter of basic fairness, I would have an overall problem with some kind of big incentive that others didn't get. Those of us that went and stood in line for an hour and a half before we even got up to the door, I think they would have some ill feeling about somebody getting paid to go get the vaccine. The time off proposal, that would be problematical. The courts are opening again. I know I have the authority to say, no, you can't have time off, but, it puts an extra bit of rancor in there that maybe we don't need right now. Everybody's straining to get their work done. Tax share is on the horizon after the courts knock down some of this backlog that they've got, which is really across the board. And if the AG starts filing trials, they had the biggest drop of all. It's really going to get tough over in the family section if they start filing cases again. Also, to me, if I were that set against getting the vaccine, I don't know that you could pay me enough to go take it. If I had some concern about side effects or whatever, so I don't know how effective that would be. What I would rather see, and I'll close with this, I thought it was a great program to open up the central jury room, let the employees come, open up the family law community room, let the employees come there. I've not seen, I hope I didn't miss it somewhere, the second shot. That was for first shots, I guess. But I'd like to see that done again, and if we're all gonna have to have boosters, I darn sure would like to see the county have these programs like you did here a few months ago. I thank you for the input.
Good afternoon. So, y'all done a lot for our employees during the pandemic, and I personally appreciate it, and so does my team. Probably 60% of my employees are not vaccinated. I have 171 employees, a lot of young moms and dads in the organization. So, to me, the incentive, you're not going to move the needle. Giving my employees, in my opinion, 40 hours, it's not going to move the needle. We have FML. You keep extending the 2 weeks COVID coverage, and that turns into, I have a headache. I can take this time off under COVID. The 2 weeks we grant, it keeps getting extended. So you're giving them plenty of time to deal with COVID, in my personal opinion. So to me, the incentive of 40 hours, 24 hours, it's not going to move, in my opinion, my employees to run and go get a vaccination. They call off on FML, they have serious medical conditions, their family does. You have extended those 2 weeks of COVID time. If they're not feeling well, they get paid to stay home. We don't want them there if they're not vaccinated. If they are, they could have breakthroughs. So it's their personal choice. And that's all we keep hearing. It's my personal choice. I'm vaccinated. I helped put together the Family Law Center. I want all my employees vaccinated. But it is their personal choice. So offering them more time, I don't think it's going to move the needle. But it is their choice. If they don't want to get vaccinated for 40 hours, they won't. You come back on the 19th and say, now you're going to start paying for your personal choice. You're going to pick up the medical costs, because we have taxpayers that come in here in public speaking telling you that you're using taxpayer money. We are using taxpayer money. But if my employees choose not to be vaccinated for fear of they don't know what it is, what it's going to do to them with their reproductive, system as women, as men, I understand that. That is their choice. But if we're going to be true to the taxpayers and say we're not going to pay for this, because it is their personal choice, then I'm all for looking at the 19th to say, you have a choice. And if you don't want to do it and you do catch COVID, then you will be paying that. Now, Tom and I had a quick discussion about the $200 surcharge. He thinks it might impact his employees. He thinks people may quit because of that surcharge. Now we're really dipping into their lifestyle. And, I didn't agree with him, but I probably do to some degree. But again, I think it's your personal choice. I highly encourage vaccinations. I will always push it for my team. But at some point, I don't think there's an incentive out there. They don't want to do it. So that's where I stand on that. Thank you.
Horse to water, but you can't make him drink.
I hadn't heard that in a while. It's good to hear that again, JD.
Pardon me?
I said I hadn't heard that phrase in a while, and it's good to hear it from you. Are you going to talk about it from the HR department, or are you to be back up here because nobody else is here?
No, I'm all talked out, thank you.
Let's call for the question, Judge. You got a motion.
Any other discussion? Okay, the motion that is on the floor right now is to, as an incentive, give 40 hours of time off, unexpires, if you are fully vaccinated by November the 19th. Please vote. Commissioner Johnson?
No.
Motion fails.
Then-
Okay, I'm gonna make a motion. Well, I guess now I'll just maybe wait till we get back here on the 19th and figure out what
What action we're
going
gonna take on employee co-insurance deductibles, that kind of thing. Okay.
But if you can remember what I said, you might want to write it down. 'Cause
Yes, sir.
I know I won't.
We'll be ready.
Well, I just appreciate everyone for their input and obviously all the work that's been done to get us to this point. I feel like that there is some type of balance that we can strike. I don't know where it is as yet, but.
Yeah, I think the
hopefully we get
discussion
there.
is just, I think it's just reflective of the internal conversations we've been having.
It's a complicated
And,
issue.
you know, what does move the needle for someone who's decided that they don't want to be vaccinated? I don't know that any of us have the answer,
I would agree.
so.
Moving right
Yes, sir. So next item, we're asking the court to approve a double fill as well as a waiver for community development. Mr. McClinton's financial manager will be leaving county service. He has identified a replacement. So his request is for a waiving of 320 vacation hours and a double fill from October 1 through 15th with a fiscal impact of $11,900 and some change to the Community Development Salary Allocation Fund.
Move for approval?
Second?
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Our next item, we're asking for extension of project employment. This is the Sheriff's Department. As described in your communique, there are 3 positions, 1 captain, 2 corporals who've been working on the JMS project. Their extensions, we're requesting extensions through October 15th. They're set to expire at the end of this month. The reason for the request is that the Sheriff's Department is in the posting process. They do have full-time positions, and so I believe they're anticipating these individuals will be a part of that process, and so they want to give these individuals time to get involved in the process, have the department make a decision before we separate these individuals as temporaries, if that makes sense. And we are looking at a fiscal impact of almost $13,000 to non-debt capital.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank
Ms.
you.
Glenn, let me ask you a question. When does open enrollment begin?
Dates, please. October 28th through November 10th.
And if we decide to do something maybe on the 19th, how difficult will it be as a part of the open enrollment to ask that employees maybe, if they would choose, to prove that they have been vaccinated, so that if we were as a court to institute
A
effective
surcharge.
January 1st, either a surcharge or you then begin having to pay for any costs, so any unvaccinated person will have to pay for costs associated, out of pocket, deductible and those types of things. And so now you would at least have had an opportunity through open enrollment
To collect the
prove
data
up
or the
vaccination.
documents. I think it could be a part of our process. The only question that I would have would be one for Leslie from the CDA's office to just get her input on whether she would be comfortable with us asking for that information during the enrollment process. I think we can make it happen. I just would,
So that's something-
I would want her guidance.
Prior to the 19th, we probably need to have one way or another, if we choose to,
We will collect it at some
we're
point.
gonna have to collect it at some point.
If that's what you all decide.
And so then it's gonna be a matter
Sure.
of, and if somebody doesn't wanna give it to us, then they don't,
Sure.
they'll just be surcharged.
Yeah.
If that's the choice of the court.
That's what we do with the spousal
Yeah, with the
surcharge.
marital issue.
So, yeah, we can make it a part of the process, but again, I would like to visit with Leslie, if that's acceptable.
Is it?
And then I'll have Ms. Duckworth handle the last item, which is the carryover discussion, but as she comes, I want to just add a little bit of information or provide a little bit of information to Judge what you referenced in Vinnie about flu shots. And so there was a county-wide email, so please search your mailboxes because there are some attachments. So it's a September 22nd email from Henry Tolstead. Henry is our wellness coordinator. And so he announced flu shots there this week. So they're this Thursday from 8 to 2, and this Friday from 8 to noon, and they're in that conference room right behind where you all are seated. And again, that email does have a consent form attached, and it also has a vaccine information sheet attached. So when you come, if you come for your flu shot, you'll need to bring the consent forms completed. No appointments, just show up during the time that I've just told you about. Of course, social distancing will be enforced. You'll need to bring your badge, your county badge. These are free, they don't cost us anything. And just make sure that you wear appropriate clothing so that we can get to your shoulder, not me, because I won't be giving shots, but so that the public health staff can get to your shoulder to give you your shot. And then I'm done.
Thank you, Dina.
Come on down, Amber.
Hello.
We are seeking the court's approval of unlimited carryover of our unused health and dependent care flexible spending account funds from plan year 2021 to 2022. If you'll recall, the court approved back in April of this year that same approval of unlimited carryover from 2020 funds to plan year 2021 for both the health and the dependent care flexible spending accounts.
Move approval.
Second?
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Devin, are you abstaining on this particular?
No. Thank you.
Motion passes passes unanimously, excuse me.
Thank you.
Do we want a break for?
So we have, obviously we have lunch. We also have a work session this afternoon. So.
We've told them we're gonna start in 10 minutes.
Yes, we did. Tell them we were gonna start in 10 minutes.
It's not his fault.
I know.
That has never stopped anybody, Commissioner.
From blaming you.
I might have estimated 2:30 at the beginning, because I think next time you pick a time, add an hour and a half to it.
Sure. So we can do one of several things. We can finish everything except the briefing item. We have one briefing item that we can come back afterwards with. We can stop now and then come back, and we'll pick up where we left off. We can maybe move somewhat quickly during lunch. What's that?
Let's move on through.
What about the rest?
I just didn't go through.
Yeah, let's keep going.
All right, let's go.
I'm fine with that.
Come on down, Melissa.
So, Your Honor, as we were doing this, we did have a person as related to the vaccine issue. This was Devin Pipes. He did not want to address the court. However, he wanted to add these comments. I'm against this on top of the $1,000 approved last week as a footnote to the raises.
And just as we discussed earlier, we did not approve $1,000 last week.
That's correct.
And we didn't also approve it today.
All right.
Go right ahead.
You want to approve all 14?
Yes, we do.
I'll be good with
that. That is an excellent idea.
I'm good with that.
Approval of L1 through 14.
I'll second that at the DA's.
We have a
office
motion
on
and a
board
second.
with that.
Yeah, we can, yes, we can do that.
Okay, we have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Commissioner Allen is absent at this point. It's
Thank
nice
you.
seeing you.
You too.
We're gonna have to.
She may be the luckiest person in the courtroom.
Come on down, Randy.
Randy, where's Mr. Beck?
I'm sorry?
Mr. Beck, he's not here?
No, he was unable to make it today. So,
Okay.
But we just have one item for you today, and we're requesting the court's consideration to reallocate 2006 transportation bond funds related to the Bass Pro Drive project. These funds would be reallocated to two proposed projects within the city of Grapevine, the extension of Ernestine Parkway and Kimball Avenue. Just as a little bit of background, in the 2006 bond program, actually programmed approximately $1.1 million to Bass Pro Drive. In 2011, the Commissioners Court reallocated close to $1.9 million from the State Highway 26 project over to Bass Pro Drive. And then that was to be matched with the city's portion to get that project widened. More recently, the Texas Department of Transportation included the widening of Bass Pro Drive as part of the improvements to the 121-635 interchange. It's the DFW connector. So that basically means that the city no longer needs the transportation bond funds for that project. And so just recently received a request from the city to reallocate $2 million of that $3 million to those two projects that I mentioned earlier. And there should be a map in your packet that shows the alignments of those projects. If the Commissioners Court approves this today, then the $2 million would be reallocated to those two projects, and it would be matched with the city. The city will put in their $2 million, so there'll be $4 million total. And then the $1 million remaining would be reallocated to each court member per the excess funds policy. And I believe I sent that to you last week.
So that's what I was gonna ask, is this the policy, is this the way we've done in the past?
Yes. So
For
if
the
we,
full amount or for just the 1 million?
yeah, well, it's $3 million that's allocated to the Bass Pro Drive right now. So the request is to move $2 million over to these other two projects. So the remaining $1 million would be reallocated to each court member.
The answer to your question is no, this is not the way we've done it in the past.
So this would be
the total amount would have gone back for redistribution to our various accounts.
This, if you don't mind, this, because I'm very familiar with this project. This is a project, the Kimball Road and the Ernestine Drive, that provides a vital hookup between two parts of the DFW connector. It improves the 26 portion of it, and it also improves from 26 over to the, I guess you'd call it the feeder road, correct?
Frontage.
Yeah, the frontage road on Highway 121, which is part of the DFW connector. And it's a project we've been kind of working on, trying to figure out how to do for well over a year. And this seems to be the best way to get to do this. And in Grapevine's defense, we got a major improvement on Highway 26, which is again part of the DFW connector, when the city of Grapevine allowed part of their money to go to a portion to redo the Bear Creek Bridge on Highway 26 and do road improvements from South Lake, Colleyville, Grapevine border into Colleyville, and included redoing about a $6 or $7 million bridge. I think that whole, wasn't that like a $13 million project? Something like that. So this is just another piece of making those improvements to the DFW connector.
Is this in the new bond proposal?
Sir?
Is these projects in the new bond proposal?
They were not submitted to us for the 2021.
They're not in the new bond.
No. This is 2006 money.
I understand, but it wasn't in the original plan Is it in the new budget?
No, no, they did not submit this to the new.
Why
the
not?
new bond program.
Why not, Gary?
Well, because they were looking to use these excess dollars that they had matched and had the money for, and we had the money for. So they had 2 million and we had 3, so.
So let me ask this question, how much bond money do you have left in 2006?
How much,
How much do you have left?
I don't have that number, those numbers in front of me.
You have a vague estimate?
I know you're at least over
We
1
spent
million.
some on 1709.
And we have some that you've already have been having discussions with other
Yeah, we've
communities
got some
about.
committed.
I don't have that number in front
And so
of me.
what they need is 2 million, right?
Yes.
So if we did it, if we gave all that 3 million back to the group and it was divided, that would be,
Okay, before you go there, I took 2 million, about 2 million, and put it on projects that were submitted in the new bond issue, and those were $2006 that I put on projects in Colleyville and Watauga. And those jobs came off the worksheet. There were 8 projects in Watauga that I paid for out of discretionary funds to get them off the worksheet because I was afraid they wouldn't rank high enough. And then there was a project in Colleyville.
I hear that, and I mean, I think I took one off too.
Which one?
Well, it was 400 and something thousand on
So Roaring Spring.
Roaring Springs deal. So I mean, I'm not saying that I haven't done that also. What I was gonna suggest is that I guess that would be, if we were dividing it by 5, it'd be 600,000 to each one of us. And I would be glad to turn over 500,000 if you had 1.5 left over from 2006 after you add in that 600,000. And then that way everybody gets.
Well, I've got other projects.
Well, I understand that, Gary.
I'm working on.
I understand that.
So, I mean, I've got other projects. This is utilizing money that has always been for working on that DFW connector project. And we've made a number of improvements on that project. I have made a number of improvements. We did a flyover that separated Highway 121 going to downtown Fort Worth and 360. We did that, which was $17 million that we partnered with the state and in some of our discretionary money. So we've spent a lot of our discretionary money. So.
Okay.
And just to follow up on this, these 2 alignments are actually on DFW Airport property. And so there's coordination that would need to take place. The Director of Public Works for Grapevine did send us a statement that he was unable to be here today, but he did send a statement saying that he did speak with senior staff at DFW Airport, and they have funded a master plan study for this area in their next budget. And he says he would expect to start that process later this fall. So that was a statement.
Okay.
This goes through DFW Airport property. Comes out there where Bone Daddy's was.
Okay.
Formerly called, a restaurant formerly called Bone Daddy's.
So Commissioner Figgis, I appreciate the background on it, on the project and how this fits into it, but I want to make sure that I'm understanding this is an exception to our policy, right?
Well, so was when I saved you $2 million.
All right, you don't have to attack me.
Okay.
It's okay.
I'm not attacking you. I'm
asking a
just telling
question.
you.
Okay.
Okay?
All right, pump your brakes, okay?
Okay.
I'm just asking a question.
You know,
I'm
don't
just
accuse
asking a
me
question.
of attacking you, please.
Well, you got kind of loud really quick, so.
All right.
What? I'm having a discussion with him, so unless you're gonna say the same thing to him, make sure.
Well, I'm saying it to both of you.
Okay, just make that clear, okay?
Well,
Okay, so Commissioner Fickus, that question wasn't directed towards you, actually. I was just making sure that I understood that this matter involves an exception to our existing policy. Yes or no? Which
Right
you can
now,
answer that,
today-
or GK could, or the judge, or Roy, or Randy.
The money has been allocated for this area
Okay,
from day one,
okay,
back in 2006. I wasn't even a commissioner, okay?
okay.
He allocated it, not me. So.
I didn't have
it was
anything to do with that,
allocated-
which is why I'm asking.
It was actually allocated on Highway 26.
Okay,
So, and then the federal government came along and picked up Highway 26 through excess stimulus funds to the tune of $12 million. And that gave us our $6 million back. And that was on the DFW connector, and we were gonna use it on Bass Pro, didn't have to. Then we started splitting it up and using it to do 26 and the Bear Creek Bridge and a pedestrian trail. And then we've been looking at this project, like I said, for, for the past year. So I think maybe Mayor Tate might have sent you a letter on this. I know
I
we
did.
okay. Well, so I'm not sure who can answer this question, because I didn't hear an exact yes or no. This is not me trying to be funny or anything like that, okay? Is this an exception to our policy?
This would be an exception to the
Okay.
policy.
Thank you, Randy.
And normally we include a summary page that may be hard to see, but for every time we haven't had one of these in a while, but usually we'll bring that, and it will be stated in that summary page. So,
any further discussion?
nope, I don't think we have one.
We don't have a motion. Well, that makes it real easy. I move approval. And I'll second. Any further discussion? Please vote. Motion passes. Commissioner Johnson?
I abstain.
Motion passes 3-1 with one abstention.
Thank you.
And so before we move on, and this may not, I don't know where this fits in the agenda, but because I can speak whenever I feel the need to speak, I will do that, is I get that y'all have your whole process for how y'all talk to each other, and sometimes you get loud, and sometimes you may go back and forth, and that's fine, I'm with all of that. But let's just make sure that as we're having discussions, that we can do that professionally. So I get if you were trying to defend your position and you felt that you had to do that with me when I was just simply asking a question, which I know that the tables could be reversed on any given day, on any given issue. But so it is disappointing that I have to ask for us to actually conduct ourselves in a professional manner. That is all that I am requesting. I have done so multiple times before, and I will continue to do so. You all pay me the same respect that I pay you all, period.
Commissioner Allen, I'm sorry you feel that way.
It's not
but-
what I feel, it's what is
Commissioner Allen?
clearly documented.
Well, you can say it's clearly documented. You seem to be the only one that seems to have that issue.
Okay.
And I'm sorry. But, you know, again, we are gonna all discuss things as we go along.
Which is
But
great.
there is a time. And this is appropriate for you to make this comment. But again, when we're on an item, as we were last week, when we vote on it, we move on. So, you
It
know,
depends on the item and it
you
depends on
seem
the
to be the only
person.
one that has the problem.
So GK, I want to formally request that we have some discussion about parliamentary procedure, what that looks like for our court proceedings. And then at some point, we need to all make sure that we understand them and that we're going to we're going to agree to abide by them.
It'll be up on the 19th.
Thank you.
Commissioner Johnson, I believe you have some interlocal agreements.
I do. Have all of these been approved by the DA's office?
Yes, they have, Commissioner.
They have?
Yes.
I move approval of item 9M, 1A through L.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any appointments? There being none, then you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Briefing items, Mr. Manning?
So we're going to defer that until after lunch. We've also notified those individuals that are going to present today that we will be starting at 2:30 this afternoon on that.
Then with that, I don't believe we have any other public comments. So we'll recess our open meeting to proceed to close to discuss items exempted under section 551.071, 072, 074, 076, and 087 of the Texas Government Code.
Under section item 9A9, we're requesting that the Commissioners Court provide approval for the Tarrant County Auditor to release emergency rental assistance payments that would otherwise be scheduled to appear on the claims addendum on October 5th, 2021, or October 12th, 2021, if the Commissioners Court meetings were to have taken place. These payments are made pursuant to the Tarrant County Emergency Rental Assistance Program created by the court, which outlines the eligibility requirements that must be met for a properly payable claim. By virtue of this extensive program, the court has made or makes a determination that each claim that meets the eligibility requirements is properly payable.
So moved.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Commissioner Allen, do you choose to abstain? Motion passes unanimously.
So members of the court, if we can now go to the briefing agenda. Get back to it here. And we're going to take up item 12B, which is a pay equity study. Ange is here to address the court at this time.
Good afternoon.
Good afternoon.
Just make sure. Okay. So I wanted to start just very briefly. I'm going to summarize these slides, given the time, with some statistics about pay equity and pay inequity. So the first couple of slides that you see are statistics based on the U.S. Bureau of Labor Statistics. These were just released last month, or this month, earlier this month, excuse me. In summary, the first two bullet points tell you that pay inequity based on gender has improved. There has been progress over the last 40 years. However, women's earnings remain at 82% of men's earnings. To break that down a little further, you see some statistics there by age, by marital status, and by educational attainment. In short, the summary there being the younger women, the single women, and the less educated women fare better when compared against their male counterparts than the older women, the married women, and those with additional education. The next slide, I wanted to also discuss some race-based information regarding pay equity. So again, the Bureau of Labor Statistics indicates that, perhaps surprisingly, a minority, individuals of Asian descent earn more than other ethnicities. I won't go into the details here, but it will tell you by these statistics that women actually fare a little bit better in these comparisons than men do. Probably because men fare really quite badly when Asian men are compared to their counterparts of other ethnicities. And finally, when you combine the two, we have earnings based on gender and race/ethnicity. And you see here that Asian and white women fare, again, least favorably when compared to other ethnicities and genders. To bring that into some perspective, I want to bring in some global information. So the stats that you just heard were US-based. These are global. So this information is actually from Korn Ferry, who you remember is our salary consultant. The global headline, as they call it, pay gap is 16%, excuse me. So in the US, it's 18%. In the global perspective, it's 16%. So we're actually faring a little bit worse than the rest of the world. What the rest of this slide shows you is kind of how to bring all of that information I just mentioned and that's on those slides into perspective. So what you saw there was really the gender pay gap. It's the macro look at statistics. As you drill down into the information gets a little bit better. So when you compare people at the same level, that 16% on the global front translates down into 5%. So that's manager versus manager, clerk versus clerk. If you compare people at the same level in the same company, so manager at Tarrant County versus manager at Tarrant County, the gap shrinks to 1%. And if you compare people at the same level in the same company with the same title, that gap shrinks to 0.8%. So accounting manager at Tarrant County versus accounting manager at Tarrant County. This is why it's important to do pay equity studies, because we have a lot of macro numbers and we have a lot of micro numbers. And reality for Tarrant County or for any other company probably falls in the middle somewhere.
Okay, I got questions.
Yes, sir.
Comparing people at the same level, the average pay gap is 5%.
Yes.
Comparing people at the same level in the same company, the average is 1. So how can, this survey would be of people in companies, right?
Companies globally. So it could be Tarrant County versus the federal government in that first step.
I guess, though, I'm still saying, though, if you're comparing them within companies and they're 1%, it would seem to me like your global population or where you're drawing from are from companies. And so I don't understand the difference between comparing people at the same level. You say 5%, but then when they're at the same level in the same company, it's 1%. And then if it's in the same company, isn't that saying that's getting closer to somebody that is actually doing the same job at the same company at the same level?
That's what the last statistic is, yes.
Okay, so why would you be comparing someone at different levels and expect their compensation to be the same?
They are at different levels, but one might be an accounting manager. I don't know what they may be at the same level, but one might be, for example, an accounting manager versus an HR manager. So if you think about it in Tarrant County terms, let's say a grade 74 manager versus a grade 74 accounting manager. So you're taking kind of the group
But
and
isn't
shrinking
that
it.
assuming then, when you do that, that a manager at every level needs the same qualifications?
To some degree, yes.
But then, I mean, to me, the bottom one, and you and I talked a little bit about this, I didn't realize from this level of detail, but what this seems to me is we're really getting down to looking at the same level, the same job, within the same company, and we're talking about less than a 1% variation.
Potentially. That's Korn Ferry's experience globally.
That's not looking at Tarrant County specifically.
No, and I understand that, and that's what, I mean, I want to get to looking at Tarrant County specifically, but all of those other things seems that there would be reasons for differences. You know, even at the one right above that, comparing the same level at the same company, there's a 1% difference. That's pretty close.
In theory.
And then the second one from the top, comparing people at the same level, the average gap is, I can't reconcile item 2 and item 3. Because it would seem to me like if we're comparing people at the same level, we're that field or that population we're pulling from are all the companies, but then yet when we look at the companies, we're only talking about 1%.
I think to some degree you're going to see other differences, i.e. geographical location. I don't know how much.
Okay, that right there.
I don't know how much their study, I didn't look into it that closely, how much that was taken into account. Could be
I think you just gave me the answer.
a number of things.
Because it could very easily be that a manager, the identical same manager in Texas, would very likely be making less than the same position, exact same position in California or New York, based upon the cost of living. So that explains the reconcilement I needed.
It's a potential
between 2 and
reason.
3. Okay.
Plus, you have situations where that you may have a shortage of a certain work type, and instead of hiring at base plus 10, you may hire at base plus 20 for that one particular deal. They may all be 74s. There's a multitude of reasons why that happens.
This actually gets right into the next slide, which are some definitions that will help us understand where we're most likely going to end up with this study. So that macro 16 or 18% global versus US is really the gender pay gap. So that's the difference in average pay, just male, female, white, black, whatever your comparison is. Equal pay for work of equal value. And the next one, equal pay for equal work, we're going to end up most likely somewhere in the middle of that. So equal pay for work of equal value, they might be doing different work, but at the same level. Whereas equal pay for equal work, they do the same thing, side by side, same exact thing. So there is a difference, and we're most likely, depending on how we structure the study, going to end up somewhere in the middle.
And within our job classification committee, because we try to, a grade 16 is a grade 16 is a grade 16.
Right.
That should make our ability to compare across departments
A little easier.
a little bit easier from that standpoint.
Right. So you heard the stats, and we've talked a little bit, but reasons to pursue pay equity. It increased employee trust in leadership as well as community trust. We increase employee engagement, satisfaction, morale, and retention. We probably could have split those out into 4 bullet points, but all same sort of things. Employees are happier. We increase performance at the employee level and at the county-wide level, productivity, all of that. maintain market competitiveness, and what I'm looking here specifically at is the market for employees. That could, from a for-profit perspective, certainly be a competition with competitors in the market, but for us, I think we don't really have a whole lot of competition, so our market is our employees. And last, but certainly not least, it reduces our risk of litigation. Step one, I want to just talk about more extensively than the rest, because that's really the only step I'm certain of at this point. So we've talked in previous weeks about gender pay equity, but there's also a race/ethnicity pay equity issue here as well. So the first question that we're looking for direction from the court is, do you want to look at gender pay equity and race ethnicity, or one or the other?
I would like to see us look at both.
I agree.
Okay.
Me too, especially because of the statistic about black women and black men, where black women made 95% of what black men made. And that is so different from the other ethnicities that it begs the question, how underpaid are black men?
Absolutely.
Which is something that the statistic does not get to.
Absolutely, correct. The second bullet point there is about consultants. So typically companies with over 500 employees employ consultants to do this. I would recommend highly that we do the same for two reasons. One, we simply don't have the capacity to do it in HR. And two, it's sort of like the fox guarding the hen house. I don't want to be responsible for looking at pay equity when I'm also responsible for creating policy and approving pay raises, or at least recommending pay raises. We have spoken with Korn Ferry. As you know, they're our consultant for market studies. They do this type of thing. They do it often, and they would recommend or have given us an approximate cost of about $25,000 at this point for a study. They do have a degree of separation from this process. While they make global recommendations, they have zero involvement in direct employee compensation decisions. So that is a company that we have already that can get ready to go for us at any point. If we had to do an RFP, that would obviously add extra time to the process. So we're looking for your feedback on how you want us to proceed.
My suggestion would be to go with Korn Ferry under a professional services contract, which I think exempts us from having to go back to competitive bids.
Yes. And if it's below $50,000, we can do that.
I'm sorry, I didn't hear you said GK.
I said if it's below $50,000, then there's no question at all about that.
I'm fine with that.
I thank you in my sleep.
Everything
Also thanks you.
Korn Ferry did was right under $50,000.
Well, it runs no
$49,900.
There's also a local rule, I don't know what the, Melissa's, the purchasing agent's rules are as far as, purchasing aspects. I just want to make sure that we keep that in mind as well. It may be lower if she's adopted additional.
I'll be sure to
Our
check.
current policy is 50, but we would work with purchasing from the very beginning on this.
Our last bullet point there, unclassified employees. So typically, this is a group that doesn't get looked at very often. We do have total full-time employees. This is excluding CSCD, about 4,200, just below 4,200 employees. Of those, 138 are unclassified, and 94 are elected officials. Now, I would recommend that we not include elected officials simply because that group there's no evaluation process for that group. There isn't, I mean job evaluation. Job evaluation process.
I feel like I get that every day, so, but I hear what you're saying.
The unclassified group in large part doesn't go through the job evaluation process either. What we can do, though, is look at them and try to slot them in. I don't mean from the JEC perspective, but from an HR perspective, we could say roughly this position looks like it could be X grade and include them that way. It would be informal. It would not be, again, the formal job evaluation process. But if you wanted that group, the 138 unclassified positions included, we could do that and give them at least a temporary grade for this purpose. Or not include them at all.
Would that be our staff?
Your staff, court reporters, court coordinators, a number of little positions here and there, fair amount of management staff.
You said 138?
I'm sorry?
138?
Yes, ma'am.
Okay.
Well, I guess what I would say is anybody whose salary is a percentage of something else, there's no reason to do them.
Okay.
Electeds, I agree with. There's something else you said that triggered a question that's gone right through. Nothing stopped it in between.
Not CSCD job.
Yes. There's no reason to do anything with CSCD, that's state. So
Correct,
we're not.
correct.
You're
I
not-
would not propose to include CSCD. Okay. I'm going to go through the rest of this pretty quickly because Korn Ferry could come in here and just blow it all up and we could have to do something different. But step 2, determining the data parameters. We would look at a variety of parameters and go through this multiple regression analysis, which I haven't done in over 20 years, so I'm really glad y'all are going to let us use a consultant. But we're going to look at gender and race, as we've talked about, length of service, position titles, grades, all of that information. They may bring in other things, departments, performance, et cetera. So when they come in and they tell us how they structure this, we'll figure out what happens next. After that, they're going to do the actual data analysis, so analyzing the data, doing that multiple regression, reviewing the results, most likely with HR first, so we can make sure that everything is properly understood. At that point, we'll have to look at transparency. Obviously, we want to be as transparent as possible. Organizational trust is crucial. At the same time, there may be legal considerations to look at given specific situations that we might have. So we'll look at that when the time comes and certainly consult with all of you. We think the process to this point could take about 2 months, potentially 3 months, only because the holidays are coming up, and as you know, that kind of slows everything down. So we believe 2 to 3 months to this point. We'll see. After we have the results, we obviously have to figure out why the results are what they are. So if there are paid inequities, we need to identify why. What are the root causes? So that could be anything from policies and procedures, it could be a new hire process, or it could be, we need to look at different data. We might need to look at education, experience. We need to dig more into the results to figure out why they are what they are. We would have the consultant perhaps participate in this section. Again, it's going to very much depend on what the results are. It may not be worth the time and the expense to have them involved at this point. Step 5, which is our final step, identify remediation methods and institutional changes. So for whatever root causes we identify, how do we remediate that? Changing policies, giving salary increases, probably a big one, training managers, could be unconscious bias training, could be whatever sort of training is out there, could be mentoring, could be a number of things. This is my ballpark timeline. Again, Korn Ferry may just come in and blow this up, but I'm hoping we can nail down everything, the contract within the next month to 2 months. I'm hoping a month. December to February, have them do the data analysis, particularly before they do the market study analysis, if possible. And then in February through April, look at our root causes, and then thereafter remediate and figure out what we need to do to fix it. That hopefully will be in time for the next budget year. Questions?
I don't have a question. I do have a comment. I just want to thank you all for the update and the work on this. And also, I have to give you all an apology. So last week when I brought this matter up, it was in the context of my opposition to elected officials getting raises. And I made mention that I had made this request, and as an aside, I said, oh, well, but I haven't received an update from HR. That was not at all meant to say that you all weren't doing what you needed to do. And that's really important because I don't make a practice of throwing anybody under the bus, especially not staff. I know you all work tremendously hard, so I just want to say that I'm sorry if at all it was interpreted in that way.
Understood.
Okay.
Thank you.
Second is, but in our discussion, our compensation discussion earlier this year, I just asked if we had done this type of study or, looked at it before, and we hadn't. So maybe we'll find that we're doing everything that we need to do.
I hope
But
so.
maybe, right, but we might find that we're not. And quite frankly, anecdotally, what I've heard from people since the day that I stepped foot in this building is that there is some inequity, not just in pay, but in treatment and other factors that certainly can make someone's day as a family member of the Tarrant County organization joyful, or it can cause them great pain and it make them miserable. So there are some things obviously that it's not our role to address and that we can't, but for the things that we can, I certainly want to make sure that we do that. And also just a reminder that I get that I'm the new kid on the block, and so people are going to bring stuff to me thinking that maybe if they tried it before and it didn't work, then maybe it'll work with me. And this is not one of those. But that also, being a woman, being the only woman on the court, being the youngest person on the court by 30 years, that there are a lot of issues that are brought to me by the next generation of folks within our organization who, if we don't take care of them right now, then they're going to leave. So from an organizational culture standpoint, I would like to keep that talent here within the Tarrant County organization, but we can't do that if we're not making sure that we're taking care of folks and doing the right thing. So that's all I have. Thank you, Ange.
Absolutely. In this market, a lot easier to retain employees than to find new ones.
Yeah.
Okay, any other questions? If not, we're going to move on.
Thank you.
Thank you, GK. Thank you, Ange.
So, members of the court, we are now going to go to item 17A, which is our work session. This is ARPA, obviously. Ms. Camarena is going to start the presentations.
Good afternoon.
Hello.
I want to first say thank you to all of our presenters today, not just for being willing to come and present this important information to you, but also for their patience during our delay. I'm going to jump right into our first set of presenters. We will be speaking today on the last 3 goals of our 4th focus area. Those goals are mitigate the impact of community violence, alleviate food insecurity, and enhance access to youth services. I'm going to go ahead and introduce the speakers for the first goal, and then I'll ask them to come up in order. I actually believe the first 3 speakers are going to be co-presenting. Is that right? Okay. Go ahead and head on up. So from Safe Haven of Tarrant County, we have Catherine Jacob, the Women's Center, Laura Hilgart, and Alliance for Children, Julie Evans. We're in charge of this. You are in charge. That big center button.
You want me to do it? I'll take the
pressure.
reins. No pressure. Well, hello. Thank you for inviting us to come today. Thank you for your focus on this piece of your work and your work session today. When we were asked to kind of joint present, it felt right to all 3 of us. We've done a lot of collaboration for years, and certainly during COVID, that's been the case as well. It's only heightened. So today you're going to hear from all 3 of us kind of throughout. You're going to hear us speak to trends that we're seeing across each of our different pieces of working in community violence, and you're going to see some of the needs that we are experiencing. We're going to start by just doing a level set, a reminder to everybody about who we are and the agencies we serve, and then we'll kind of take turns and make sure we give you some specifics from each of our agencies as well. So with that, I will start. My name is Julie Evans, and I serve as the CEO of Alliance for Children, and we are your Children's Advocacy Center. And as an advocacy center, our job is to create a safe place for children involved in a child abuse investigation that rises to a criminal level, and really create a neutral place where kids can come that's designed with them in mind, to give them the safe space to tell their story. We co-locate together with all the different professionals that are charged with investigating this level of abuse, such as law enforcement, child protective services. We have a medical team. We partner with your district attorney's office, and together we are walking children through that criminal justice system, providing support and services that that family may need during the course of the investigation, but really leading them towards healing.
Good afternoon. My name is Catherine Jacob. I serve as the president and CEO at Safe Haven of Tarrant County. We are the county's state designated family violence center. So that designation comes to us from the Health and Human Services Commission. We run both of the domestic violence shelters here in Tarrant County, the domestic violence hotline, and a variety of other support services. We also work with these two women all the time. I think Julie and I were on the phone every week, I think for a while at the beginning of the pandemic, but we're just really grateful that you've taken the time to learn more about this today.
Good afternoon. I am Laura Hilgart. I'm the CEO of the Women's Center, and we are your rape crisis and victim services program in the county. In fact, we operate one of the largest and most comprehensive rape crisis and victim services programs in the country. We provide a whole continuum of care from our 24-hour hotline to 24/7 coverage at hospital forensic rape exam sites. 70% of those are done at JPS. The other 30% are done at one of 6 THR hospitals. We provide lots and lots of long-term counseling for survivors of child sexual abuse and adult sexual assault and rape. We have an attorney that helps with with legal issues that result from victimization, and we do a whole lot of prevention work with adults, with professionals, but most importantly with 100,000 children a year. So as we get started talking about our individual needs and how those have changed over the course of the pandemic, we want you to understand the impact of child sexual abuse, adult sexual assault and rape, and intimate partner violence on individuals and on the community. What we know is this, is that left unattended and without intervention, and those are the key words in this statement, that victims of those crimes I just mentioned are 3 to 20 times more likely to suffer from post-traumatic stress disorder, substance and alcohol abuse, serious mental health issues, including suicide ideation, inability to work, school dropout, and future abusive behavior. But we also know that with intervention, those problems do not have to manifest in people's lives, and that they can go on and live happy, healthy, productive lives. So as we go forward, we want you to understand both the pandemic and the needs resulting out of the pandemic and our capacity to intervene in those problems. I'm still on. Okay, I'm going to speak about we're back and forth and back and forth. So first of all, you probably have heard that during the pandemic there was actually an increase in incidents of all of these crimes. Part of that was because people were trapped at home with their abusers. Remember that most child abuse and most intimate partner abuse is perpetrated by somebody the person knows and trusts and often lives with. So we've got people trapped at home. That limits their capacity to reach out for help. For kiddos in particular, they don't have access to a trusted adult that they can report their abuse to, and so they are trapped with their abuser. And then also, as a result of COVID, these families were dealing with all other kinds of issues related to the pandemic: housing insecurity and food insecurity, and just the trauma, the day-to-day trauma of managing their lives amidst COVID. For the Women's Center, what we saw happen as the pandemic has begun to wane is pre-pandemic, we were going to 71 forensic rape exams a month. Post-pandemic, that number is 89 forensic rape exams a month. Now, what we know, again, from research is that, and this is research in Texas, only 6% of folks ever report for medical care. So if 89 a month is only 6% of those who have been sexually assaulted in Tarrant County, that number is more like 1,480. Unfortunately, at the same time that is happening, our wait list for services has increased to 241 people, and that is kiddos. We start seeing kiddos at age 2 and adults, 241 people waiting 3 to 4 months for a therapist. So that has been
that has been perpetrated, don't mean no pun intended there, by the fact that we've had staff vacancies and just more and more people in need as they begin to deal with the trauma of their victimization.
So quickly, we too at Safe Haven have seen an increased need. The needs have changed over time. So I think at the beginning we had a rapid decrease in our hotline calls. Then for a while we were about 30% above our normal hotline calls. But presently, and this could change also, our shelters are actually at capacity. However, if someone calls us and they require a safe and anonymous place to hide from their abuser, we will not turn them away. So we have a lot of different ways where we can meet that need, and we are using those. But just as an example, we presently have some families that are staying in our gymnasium in our Arlington shelter because of the calls that we've gotten. So we don't turn victims away, like I said, if they require a safe and anonymous place to hide. So we are still kind of at a moment where the shelter is very full. For a while there, and this still happens occasionally, we plan shelter pickup points with our clients. We won't go on scene to pick up a client to come to shelter, but we'll plan to meet them somewhere. And once some of our clients figured out how to call the hotline while they were living with their abuser, they didn't quite figure out how to get out of the house to be able to meet us at the shelter pickup point. So for a period of time there, the amount of vacancies that we saw when we would go to the pickup point, there wouldn't be anyone there, was pretty high. We are getting back to a situation where people are showing up to the pickup points, and that's a really good thing, but the numbers are still quite high. We also still have our mobile trailers at our shelter locations, and that gives us the ability to quarantine families if we need to. And we've also used that a little bit for overflow.
So for your child abuse reports, as we've spoken, I feel like together before, initially we saw this plummet of child abuse reports. As Laura mentioned, all at once we had a reduction in the layers of safe adults that our kids tend to make an outcry to, or an adult tends to see something. So it's not just the loss of teachers we experienced, we lost pastors, Sunday school teachers, soccer coaches, grandparents. And so while initial reports were almost cut in half at the beginning of this pandemic, despite that cut in half, what you had is this lethality increase, this violence increase. So when you fast forward to today, what we're seeing is that violence is still at an all-time high level, and the numbers are all the way back up and then some. So when you look at the general child abuse reports that are coming to our county, not only are they back to pre-pandemic numbers, they're higher than that. And so for our lane, when we are really navigating in the worst of the worst, and oftentimes for those kids, the first point of entry can be what we call a child forensic interview. We are seeing a 15% increase in children requiring a child forensic interview. So across the board, when we looked at services in all three of our agencies, one unified message that we saw is that increased violence and increased lethality. Whether child or adult entering our system, we're seeing that across the board. To give you a very concrete example of what that means for children served by Alliance for Children, we had a 26% increase in children coming to us as a part of a severe physical abuse investigation. And so for us, when we use those words, those are things like broken bones, head injuries, burns, things of that nature, child fatality investigation. So a pretty significant increase in a single year's time. In addition to that, we had a 52% increase in kids that had witnessed a violent crime. So these are kiddos that are coming to us as part of an investigation that maybe they were the witness to a homicide, witness to a stabbing in their home. So we saw this increase not just in those that were a victim themselves, but those that were a witness to something else that brought them through our doors. And you'll see that kind of play out in the other two demographics as well.
And I just want to add to what Julie said. What we know is that that first experience that a victim has with a helping system can have a significant, make a significant difference in their willingness to participate in the criminal justice system and their willingness to seek healing services for themselves going forward. So that our capacity to respond when people need us is critically important for the system and for the individual. At the Women's Center, what we have seen is also an increase in severity and lethality. So we have seen our suicide ideation among sexual assault victims increase from 2 a month pre-pandemic to at least 1 a month, once a week, post-pandemic. We've had a couple of our clients actually commit suicide and attempt suicide, so that people's feeling of trauma upon trauma upon trauma and the desperation that they are in is very, very significant for people. The other thing that we are seeing is an increase in debilitating anxiety and depression, which is manifesting in sleep and eating disorders and suicide ideation and agoraphobia and panic attacks, which means that folks can't work, they can't go to school, they can't parent well. So again, these are problems that are keeping people from living full lives and keeping families from functioning in a healthy way.
Similarly, we have had an increase in severity, but I will say one of the things that Safe Haven does is we partner with the District Attorney's Office to lead the county's adult fatality review. So there's a multidisciplinary team. We get together on occasion to review all of the what we believe are presumed intimate partner homicides that happened the prior year. Our report will be released, I think it's on Monday, for 2020. We have a couple more names that we're actually reviewing tomorrow to potentially add to that report. But even if those names do not get added to the report, the number that we have for 2020 is at a minimum double the number of homicides that we had in 2019. So our community was on a steady decline since 2016. We had a pretty significant year in 2016. But in 2017, the number went down. 2018, it went down. 2019, it was the same level as 2018. And in 2020, we believe that number had doubled. So it went from 8 intimate partner homicides in 2019 to 16 or possibly more. We have a couple more names to review tomorrow in 2020.
Where are you in 2021?
I don't know the number off the top of my head, and I thought about that on the way here, but I have talked to Elena Bangs, who's the chief of, and she said that we're actually doing a lot better in 2021. So we haven't started reviewing the 2021 names yet, but just as a feeling, there hasn't been nearly as many. And 2020 was particularly disappointing because we had gone from September of 2019 to March of 2020, 6 months without an intimate partner homicide, and our goal as a community in this group is to go 12 months. So we had never made it really 6 months before, and then the pandemic happened, and that really changed a lot of it. I will say the only one other thing I want to mention on this slide is that one of the things that we've seen, and I don't understand it quite yet, is that abusers have started showing up at our locations with a lot more frequency than they have in the past. So we have an internal process for that. When a known abuser shows up at one of our facilities, we send out an abuser alert in our internal email system, and then a couple things happen after that. Prior to the pandemic, we would maybe have one of those every 6 weeks or so. Now it seems like there are 1 or 2 a week. Last year we had a bomb threat on one of the shelters. So it's that the boldness, I guess, and the brashness of offenders has gotten really high. Last week we had, and Julie and Laura know this, we had an abuser who showed up at our administration building. And then 2 days later, we had another abuser show up at one of the shelters and said that if he saw his wife there, that he would shoot her on sight. So we're obviously talking to PD about that regularly, but that's something that we're really having to deal with a lot lately at Safe Haven.
I'm assuming that you do things like take their cell phones and disable the GPS and.
Yeah, so we do we don't take cell phones. People can have access to their cell phones, but we show them how to go through the technology to make sure that they're not being tracked. We can't control it if a survivor tells an offender where they are. Sometimes we have teenage children who tell dad where they are, and I can't fault them for that. That's their father, and they're doing what they feel like they have to do to keep themselves safe. But we are seeing this quite a bit. I
can tell you for 2021, the child abuse numbers are staying at this heightened rate. Judge, I know you asked about that. In fact, we are seeing more kids come into our center than any time in our 30-year history. And again, we're just seeing the worst of the worst. So it really does send this alarming fear of how long we're going to stay at this level and how long are we going to be able to keep up. And at a time when agencies like ours are seeing a decrease in federal funding, like through Victims of Crime Act, it really is putting at an all-time concern for how are we going to keep up with the increased demand for services that all of us are facing, the cuts on some federal levels that we're seeing for key true staff positions, hiring dollars that we're losing. It really puts the concern at all-time highs for a lot of us to keep up. Just to give you a very 1 week example, week before last, we were starting to look at this, we had 39 new kids walk in our centers as part of a forensic interview. Our team responded to 4 child fatality investigations within 48 hours. So when I say it's still high, I mean it's still high, and when we respond, it's not just Alliance for Children staff, it's Child Protective Investigations, formerly known as Child Protective Services, it's your law enforcement agencies, it impacts ultimately what's going to prosecution at the DA's office, our medical component, so it's this ripple effect of this increased demand for services for our child protection team. And while we're increasing demand, I think all of us found universally, we're also struggling to find staff. So whether this is from difficulty recruiting or maintaining staff at competitive salaries, this is something that across the board we are seeing where we are having this heightened turnover at each of our agencies. Working in trauma is hard on the best of days. And when you layer in this increased rate, this increased demand with fewer people, coupled with the fact that they're all navigating their own personal challenges that this last year and a half have brought, we are seeing increased turnover rates. I know one of our biggest struggles is maintaining staff that also have bilingual capabilities, which is so critically important for us here.
So are the federal dollars that you get through your grant program, is that a substantial portion of your budget, or is it, in ranking, is it half of your budget? Or?
So what we're losing for Alliance for Children for this year, our budget is $6.5 million, and we're going to lose $268,000 this year. And the state's projecting by next year that will be closer to $480,000. So it's a pretty significant amount. And I think for this year, we are going after a lot of private funds to help us make that right, so we're not losing positions. But that's a short-term answer. You know, that's not a long-term fit. Part of this is the funding source. Victims of Crime Act is a federal funding stream that this last couple of months, let me be more specific, the federal government passed a fix that would keep this fund intact at a better rate, so we're not facing this. But we're talking about our grant, unlike Safe Haven and Women's Center, we go directly to the governor's office for our grant, and the governor's office is telling us that they're predicting about 3 fiscal years of challenge until that fund is back right. So that may be more than you wanted to know, but I hope that answers. Yeah.
Are you all 3 of you experiencing the same thing?
Absolutely. So our budget for rape crisis and victim services is right at $1 million. We are losing $175,000 in this current fiscal year. And as Julie suggested, the governor's office is also telling us it'll be about 3 fiscal years before we can be up to the same level that we were coming into this fiscal year.
And what is the reason they're using for that?
Well, the reason is that it's a complicated story, but the fund that pays for Victim of Crime Act funding are white-collar restitution dollars. And what happened as there was, help me with this, Julie, but as there was fewer court cases.
So when the courts were closed, and so if the courts were closed, therefore the money's...
Exactly. That's exactly what happened. And so what they have fixed that in that now that even if those are settled out of court, there will still be a fee associated with that. So that fund will slowly build back up, but I think it will take 3 years.
And I'm not suggesting that they use part of the $16 billion that they're using for other things.
Yeah.
And that is not just on white collar, that's on almost all criminal charges.
At the federal level, yes, and any of those fees that are assessed as part of that charge, if you will, or that ruling, are then put into the Victims of Crime Act. And prior to this bill, in addition to the fact that cases weren't happening, if it was a plea, that would then put it somewhere else. And so this really shifted regardless of how it's handled. If it's a offense that carries that criminal fine with it, it's going to go into the Victims of Crime that then will go into state. So I do think the fix is a right answer and gives us a longer term security for those funds to ultimately serve children and families here that are victims of crime, but it's just going to take us a little bit to get it back.
And so you think that in a 3-year period that fund will repopulate itself and give you the monies that you had currently?
That's the estimation from the governor's office. That is true. They are thinking is about a 3-year window, including with that starting with FY22. So that grant cycle starts 10/1/22 or 21. Excuse me. Yeah.
Bridge funding would be something that would definitely help these organizations.
Absolutely.
And Russell, again on that would, where is the money going from the state? It would be nice if we had some sort of an indication as to how much of the money could have come back to filling these holes.
So on that note, though, I want to be clear, Safe Haven is unlike the Women's Center and Alliance for Children on this issue. Our grant funding through criminal justice goes through our local COG, and the way that the fix worked, it didn't impact Safe Haven in the same way because of the route that our dollars take.
So you all aren't facing any type of funding shortfall?
Not that type.
Not that type, okay. I was like, I'm
Not that
thinking
one.
that there's probably a gap somewhere.
Right, though
Okay,
there
very
is.
good.
So one of the things that we wanted to mention on the staff issue, I think to Julie and Laura's point that this work is hard. People aren't desperate to work in gender-based violence. That's not something that's a real popular profession. But I do want to say, so we have about 40 vacancies. When we are fully staffed, we're at about 165. And I tried to do some analysis of that before I came here today, thinking in my mind that most of those are our clinical positions. We do have quite a few clinical positions that are vacant. One of the reasons for that for us is that when you're a therapist in gender-based violence, it is not safe to do that via telehealth. You need to do that in person. And a lot of our therapists now have the ability to go out in private practice or go somewhere else and work from home. And we don't have that ability. So that ends up being a challenge. But it's really not just our professional positions. It's a lot of our, we're short-staffed with cooks. I have been known to cook in the shelter recently. But we have, kind of custodial staff, some of our lower level staff. So we really had to look at salaries and how competitive our salaries are because people are just choosing to do other things.
You find that our CDBG funds, we also provide a large amount of wraparound services, but it is not the type of labor-related issue that these ladies are talking about.
We are in the same boat when it comes to staff, and in addition to our clinical staff, one of our biggest needs is the staff that go to the hospital to be with folks during their forensic rape exam. So, we used to depend heavily on volunteers to do that. Well, you can imagine what happened to those volunteers during the pandemic. They just disappeared for the most part. We were able to repurpose some of our government funds in this last year, and what we did was we were able to hire 2 Women's Center employees who are actually housed at John Peter Smith Hospital so that they are there the day shift and the evening shift to be with survivors as they come in, which is a wonderful model. We do not have the dollars to hire a third shift or the late night shift for John Peter Smith Hospital. Again, that's where 70% of the forensic rape exams occur in Tarrant County, or the THR hospital site. So our commitment is that we will be at the side of a rape survivor within 30 minutes for 100% of every hospital call for that service in the county. That is getting harder and harder to do. We really do need a third shift at John Peter Smith Hospital, and we need volunteers who are very well trained. We do 40 hours of classroom training and 15 hours of on-the-job training in order to staff those other rape rape exam sites. It's a critical need. As I said, we know that people who have a good experience in that moment are much more likely to participate in the criminal justice system, so that we're taking perpetrators out of the community, and they are also much more likely to seek healing services for themselves, so those critical problems that we discussed earlier do not have to manifest in their lives.
So Laura, I have a quick question.
Sure.
So with you mentioned the JPS and then THR, and that's Arlington Memorial, right?
Say again?
Is that Arlington Memorial?
It's Arlington
Right.
Memorial,
Still
it's
has the-
THR Southwest, it's Alliance,
Oh,
it's
okay.
all of the THR hospitals in Tarrant County.
Okay, and so then do all these THRs have, I guess, would it be the same room or same clinic or?
Yes, most
Okay.
of them have a SANE, what they have, THR has a mobile SANE unit
Okay.
that travels around to their hospitals as they're needed. Again, since most happen at John Peter Smith Hospital,
Mm-hmm.
that hospital actually has a on-site SANE program, so there's always
Right.
somebody there to do a forensic rape exam.
Okay, thank you.
There's just not always an advocate and advocates are critically important because they are the folks who are taking care of the survivor's emotional needs in that moment.
Thank you.
So as you can hear, all three of the organizations really have a staffing need. And so with some of the financial challenges that we're facing, it just layers in the impact of that. And it's not just the front line, but how do we also bring in supervisors who ensure that services are on par with where they need to be to provide the clinical licensures for our clinical staff as well. So it really is this layering effect. I know I spoke about bilingual. I would just add that for our two primary crimes against children units within that we co-locate with, Fort Worth Police Department does not have one single detective assigned to crimes against children that speaks Spanish. Arlington Police Department has one that hasn't started yet. So even that is a layering piece that we take on as an agency. So we provide staff that can translate on behalf of that. That alone is a huge time, and yet it's so important to us that we really meet that family in the language that they speak. And so that alone is a huge piece of some of the structure that we're needing internally. So as Catherine and I were back here and Laura was speaking, Catherine said, "Man, this is the saddest presentation ever." and that's not lost on me that we're giving you with some really hard facts, and yet that is our job, to be transparent with you, and that is our job to tell you about the reality of what community violence is presenting. And yet I also want you to know there's been some wins out of this as well. So just to kind of provide you a high-level look at that, as you can see, hopefully demonstrated with the three of us here today, this community continues to collaborate, and this pandemic has put that at an all-time high. So we are often crossing over, but I think this just put it at an all-time high for us to really work together and challenge each other to find the gaps and fill them collectively together. So I want you to know that that's happening at all-time rates. Mention was made of telemental health. That is a uniform piece of a lot of work that each of these agencies are doing. But Catherine brought up a good point. It is not the answer for everyone. We really have to make sure to paint that picture further, if Catherine's team is dealing with someone involved with intimate partner violence, telemental health doesn't allow us to ensure that the offender isn't across the room watching. The same is true in child abuse. So you really have to be mindful that it works for some, and it can be a great elimination of transportation barrier, right? It's a huge factor, but it's not the answer for all cases that we're coming in. And so we are having to now say, when does it work? When is it appropriate? And maybe when is it? We're also beginning research over therapeutic interventions that are shorter in duration. Our focus is on trauma, and for all of us, and yet, given the demand for services, we really are going to have to invest in advanced training that still provides evidence-based training, but are there times when we can maybe not do the full gamut of a 20-week, 24-week counseling program, but instead for kids when it's fitting, do something shorter so that we can serve more in a more timely manner. So those are some things we're looking at, all while taking a renewed focus and a broader focus on the prevention of violence. What does it look like in our different avenues if we take all that we know from working these cases day in and day out and try to go broader and look in a prevention lane? Now more than ever, that's a priority for all of us. So as we wrap up, we just want to tell you a few key needs that in addition to what we've talked about. We know that new investments are going to be needed for the community to adequately keep up and mitigate the impact of violence experienced by all. One of the things, just to give you a very key impact that the pandemic has provided on us, our agency just prior to COVID embarked on a capital campaign. And this was to address the space needs at our Arlington, Fort Worth, and Northeast centers, our three biggest investigative locations, all already out of space before demand increased. And that original budget of $15.8 million, we've raised $15.4 million of that, and it's not going to be enough because of the impact on construction costs that we're seeing come in at 20% higher. So when you couple that, which we know we need the space in order to keep up and to provide workspace, but it's just going to make reaching that milestone to be able to break ground significantly harder, coupled with some of the other things we've talked about.
Our needs have changed over the course of the pandemic, but I would say right now, the two greatest needs that we have are increased legal support. So we have a legal department. We have 2 attorneys who work for us, work with victims every day. It used to be divorce and child custody cases. It is now almost always protective orders. Our staff recently met with the district attorney's staff for protective orders, and basically they came to the conclusion that we could have 6 more attorneys, 6, and still do enough protective orders to keep those folks employed full-time. So that's a real need for us.
Well, we'll hear about that in the next budget session.
Yeah, it's like, oof.
I'm glad you came this week as opposed to last week.
And then the second thing is, it's a unique situation, but Safe Haven aims to keep victims safe, but we also aim to hold offenders accountable. That's a really important piece of our work. We feel like that's what moves the needle. And so we run the largest in the state's partner abuse intervention program that is a court-ordered program, and it is accredited by TDCJ. And typically, the clients who attend that program have to pay. That's part of the curriculum. And it helps us have an earned income stream. During the pandemic, we have gotten a waiver from our accreditation. And part of that waiver is that we cannot discharge a client for non-payment. So a program that costs us about $500,000 to run and used to pay for itself, now we are only collecting about $270,000 for that program. So, and we can't discharge those folks. They have to get on a payment plan, and we have to really work with those offenders. So that it's presented a little bit of a challenge. We have some private support for that for this year, and I'm hoping maybe that.
You dictated that you could no longer kick them out for not paying?
Our accreditation. So it's with the Community Justice Assistance Division is the part of TDCJ that gives us our accreditation.
So it's the state.
Yeah, so part of the waiver that we have says that. It also says some really good things. The waiver also did some really great things for us, so I don't want to sound complaining.
Well, but no, again,
It's your unfunded mandate.
that's right.
Yes,
I mean, in effect,
certainly.
what they're saying is, you don't have to worry about paying anymore because they can't kick you out anymore.
Right.
And,
Yes.
and these people are such high quality, they wouldn't have been in the program.
Yeah,
in the
they're real
first place.
honest folks.
They're real honest folks.
So yeah, it's
Only
been
doing
it's
good
a real
things and-
treat getting to work with them.
Yeah.
So the Women's Center's need looks very much like these other needs, in that I would say that what we all need is we need more staff now. Unfortunately, we have funding that is being cut, and the price that we have to pay for those staff is growing day by day. So not only do we need staff now, but as we look at people who are equipped to do trauma work with kiddos and with adults and with problems that are so severe, we need to find a way to invest in a pipeline of those workers for our community into the future. We don't really have any idea what that looks like. It's going to take some creativity and probably some work with our universities, and there are many of them in this community, but we need to find a way to increase capable people who are willing to do this work into the future. But right now, our need is about getting more people to do the jobs that we have and to meet the needs that we have. In terms of the Women's Center, I would say that our greatest need is that third shift forensic advocate at the hospital, at John Peter Smith Hospital. because again, that is such a critical moment in the healing process and the criminal justice process for these survivors.
What's the cost of that?
The cost of advocate?
The third shift?
A third shift, I think it's probably $70,000. I mean, I'm doing that off the top of my head, but
They're talking about you behind them.
I just said you pay better than we do.
Well, that's not just a salary, that is salary and benefits and all the stuff that goes into that. So, and here's the thing, I always say round up, so in a moment like this, but I think that's probably right. But what I do want to say to you all is, first of all, I want to thank you for your time today. I want to thank you for the investment that you all have already made in this really critical work, and for trying to understand how best to use the ARP dollars to make this community safer and better for all of the citizens, especially for our most vulnerable, our survivors of crime. I want to leave you with, because Julie was saying that this was a really depressing presentation, and it is. It's hard work, which is why it's so critical to get the right people to do the work and to retain those people to do the work. But we do have one such person at the Women's Center. She's a woman who's done nothing but see sexually abused children all day, every day for 22 years. And so I said to her at about Mark 15, because I've been there forever, I said to her, Sandy, how on earth do you sit in a room all day, every day, and hear the very worst things that can happen to our most vulnerable people in our community? And she said, well, Laura, here's the thing. I do have to sit in a room day in and day out and know and listen to the worst things that can happen to children in our community. But I also get to see and hear and know the best thing. And the best thing is this. People can overcome anything with some hope and some help. So we are in the hope and help business, and we are grateful for you for being our partners in the hope and help business, because it makes a significant difference in the lives of individuals, in the lives of families, and in the lives of our community. Thank you.
Well, and let me just say to all three of you, what makes this not so disappointing or much of a downer is because we know you're out there working day in and day out. One question that I have, and I go into many communities and I'll hear about this backlog of sex or of rape kits. We have no backlog.
I will tell you, we might have some backlog, but it is significantly smaller than I'm not prepared. I don't know the answer to that question, so I would have to get the exact details on it. But I know that our backlog, if we have one at all, is minuscule compared to most.
I hope we don't have a backlog at all.
I'm not sure. I'll have to ask Sharon.
Yeah.
She'll be here soon.
Yeah. My guess, like I said, if we have one at all, it is very, very small. I do want to say this too. I've talked a lot about JPS standing here. I will say that JPS at this moment is maybe the most respectful, responsive, effective, efficient place in which to have a forensic rape exam, maybe of any place in the country. You all should be very proud of your county hospital.
Thank you.
Go ahead and tell one of your board members he needs to give a little bit more money.
I'll work on it.
I will too.
Thank you.
Thank you.
Thank you.
I'll ask Pastor Rodney McIntosh to come forward. He is going to speak to the court about the work that his nonprofit VIP Fort Worth is doing to combat gun violence in the community.
Good afternoon.
Good afternoon. First of all, I would like to say thank you for this opportunity to come and share with this county the work that VIP Fort Worth is now doing in the city of Fort Worth. My name is Pastor Rodney McIntosh. Okay, there we go. My name is Pastor Rodney McIntosh. I am the director of VIP Fort Worth, which stands for Violence Intervention and Prevention Fort Worth. It is a program that was started in February of last year, 2020. As you know, right now in this country, we're in the middle of a pandemic. But I believe as a young man that grew up in the city, we've been dealing with an epidemic for years in our community. So much so that the now President Biden has literally in April made legislation around building CVI programs, which literally means community violence interruption programs. VIP Fort Worth, again, is a little different than most programs or most mentoring programs that you would have in your city. But because me and the men that work for VIP Fort Worth have signed up to target those young men in our community or in the community, impoverished communities, who are not just victims of the violence, but who are actually the perpetuators of the violence. Because the reality of the matter is we have a demographic in our city or in our communities that nobody wants to target. A lot of people would rather, I guess you could say, turn away from. But I believe as a young man, again, who grew up in those areas, that if we don't provide them some means of help, some means of resources, something that can help change their life, then we will continue to see this epidemic plague the inner cities. The slides I have, I just want to show you, and I'm sorry to everyone. I know they kept saying that their presentation was sorrowful. I think mine may be even more, because I want to bring the numbers to bring attention to literally what we're dealing with off in the inner city. So this first slide was 2019, pre-pandemic. And I actually want to, if I have the time, just to kind of show you a few things. If you would look in the Black alone and Hispanic communities, there literally was 42 homicides in 2019. There was 16 homicides by race, 16 homicides Latino in our communities. And when I say in our communities, I know we're showing these numbers and they're saying Fort Worth, but I'll make this make sense in a few minutes. By the time the pandemic hit us, we look at 2020, we have now seen an increase. We went from 42 homicides to 60, and then 26 when it came to Hispanics. So now we're looking at January of 2021, heading to June of 2021. Again, these numbers that we receive come out in 6 months intervals, so that's why we don't have the numbers for the rest August, July, August, and September. If you would look at the African American murder rate, murder numbers, it would appear as if they would be the same. But now, if you notice, the Latinos have increased. So I had the privilege of having a conversation last week, I believe, with some people from Christian organization, and I told them what I believe as the director of this program happened is when COVID hit the inner city or in our communities, we now had young men trapped in houses who were living in impoverished situations who developed cabin fever. So the moment we were able to let those young men out into our communities, and now remember, we're letting them out into our communities, but the reality of the matter is there are a lot of people that are literally staying at home that are fearful for COVID, but these young men now have free reins in our communities. So what we have seen now in the inner city is we've seen an uptick in the rise in violence. And the thing that is getting me when it comes to this program is because if you just look at some of the cases that we've seen in the news, a lot of these numbers now, the ages of the young men that are perpetuating the violence, the age is going down. So VIP Fort Worth is a program that literally starts dealing with young men from the age of 11 to 17 on the juvenile side. But then once we get to the adult, we deal with young men from the age of 18 to 29. And I will be honest, this job that we do, the work that we do is dangerous in itself, just being around the young men that we're dealing with. And I definitely want to make sure y'all understand what this program does. So what VIP does to make this effective is we take young men who were previously either involved in violence themselves, who may be respected in their communities, and we use them to go back and be the mediators to stop this violence. The people who work for VIP Fort Worth have to be trained in de-escalation, emotional intelligence, emotional maturity. They have to take sexual harassment cases. We have to make sure that we understand that the main purpose of this work is to build these young men up and not tear down these young men or tear down our communities. And I'm a firm believer in you can't help somebody if you're hurting yourself. So we make sure the people who are part of our staff, that they understand the necessity of helping themselves first, preparing themselves for this work that we're going to do. Okay, so these are the citywide numbers for shootings in Fort Worth. Citywide number of shootings. In 2020, we had, gun shootings that injured a person, the number was 333. And I know there's a lot of different things, but again, I'm just focusing on gun violence. When you, in 2021, when you see injury to persons, it was 214. Now let's be mindful that this is only half of the year. And I'm pretty sure all of us living in Tarrant County, living in the city of Fort Worth, has seen the news. All you got to do is watch the news and you'll see. And that's the thing for me having this job. It got so bad for me that at one moment I would wake up every morning to look on my phone, because I would get a notification about a shooting, to see if there actually had been a shooting in my neighborhood. Now, I'm not looking just to read the newspaper or just to see Facebook or Twitter. I'm looking to see if somebody lost their life and what can me and my team do to help them. So again, 333 shootings in 2020. So in June, by the time June 2021 hits, we're at 214. If we were to take those numbers and stay at that pace, we literally would have 428 shootings in the city of Fort Worth. That's 85 more than what we had last year in 2020. So what that means is we're literally looking at roughly a 25% increase of homicides in the city of Fort Worth. And I understand that I'm here talking to the people of the county. So if that's happening in your largest city, just imagine if we took all the numbers together for the county, because again, VIP focuses on Fort Worth and we work in Fort Worth. But if we took the numbers for all this county, I believe that those numbers would be drastically higher than what we see right now just in the city of Fort Worth. And just to make this make sense when it comes countywide, I don't know if y'all seen it, but again, I pay attention to these things and I see them. There was a young kid at the age of 15 who was at Wet 'n Wild earlier this year. That's this county. That's Arlington County. He lost his life because of a fight. We had a shooting at Six Flags a couple of months ago. Like, we're literally at a place in our city and in our county where violence is on the rise, so now people are no longer comfortable or feel safe whenever they're going out, right, just to enjoy time with their families. Because again, Wet 'n Wild is a place you just want to take your children and be able to enjoy, and allow them to enjoy the summer, enjoy life. So VIP Fort Worth is a program that works on the east side and the south side of Fort Worth, Texas. So our program is located in Meadowbrook, Handley, Eastwood, and Stop 6 on the east side of Fort Worth. When it comes to the south side, of course, we work in Highland Hills, we work in Summer Crowley, we work in Lower and Higher South Side. And so if you were to look at this slide, you would notice something. It says inside the boundary. So inside the place that we work, last year we saw 130 shootings. And again, that's just in those areas. I'm not even giving you this whole city, just in those areas we saw 130 shootings. Well, just to June of 21st, 2021, or June of this year, we've literally already seen 85 shootings just inside of our boundary. And again, if you were to take those numbers and multiply them, again, we would see another 25 to 30% increase of violence in our community. That's the reason I came here. That's the reason I believe I was asked. I need this county to understand, as well as the people of Fort Worth, that we're dealing with a serious problem in the city. And I definitely want to make sure that we look at these, because these are the areas that I just told you we work. And I want you to notice something. They are literally minority areas that we're seeing all this violence in, right? In the area that I work in, 96 to 100% of it is minorities. So it's either black or brown people. But notice what else is connected to the minorities: the poverty rate. So it's not, so I definitely want to make sure, I always tell people whenever I come to talk about this program or talk about these young men, I don't want them to be seen as villains. I want them to be seen as victims. They're a victim of the circumstances they're in. They're a victim of the community that they may be growing up in. They are definitely a victim of the poverty that they are dealing with, right? So VIP Fort Worth has decided as a program to invest into the lives of these young men. It is our goal as a program to literally teach these young men everything I just told you that we've learned ourselves, but to also offer education in the ways of trades, in the ways of college preparation, as well as getting them into college. And the reason I'm so big and adamant about the trades, I too myself was a young man that was a part of a gang and a part of violence. I went and took an air conditioning trade maybe 7 to 8 years ago. Now I own my own company. I provide for my family, and I'm a productive citizen of this city and this county because I decided to invest in myself. Well, a lot of the young men that we deal with, they don't understand self-investment. So VIP has decided that if we don't do anything else, we're going to make sure that we can show these young men that there's value in their life. And the way that we do that is through building relationships through this program. This program is based off a fellow motto, and when I say a fellow motto, what we do as a group of men, I have 5 men that actually work for VIP as of right now. And each man has a fellowship of 10 to 12 young men. It is his job to focus on those young men. If they call them at 12, 1 o'clock in the morning, this is the stranger's job. You have to get up and make sure that you go and make sure that your fellow has everything that he needs and that he will be okay. VIP Fort Worth as a program last year was able to stop 25 shootings in our communities. I literally, and I would say it's a privilege because I've had mothers sit in front of me and look and say, I didn't even know we had men like this in our communities. Those are the things that drive us and that push us to do this work. I literally was in an incident last year in October where I actually grabbed a young man by his hand, pulled his hand down, and kept him from shooting another young man. And the thing that moves me about it is because for some people, we only see the life that was saved that didn't get killed. But I believe that day I saved 2 lives because this system is going to take the other young man and incarcerate him for the rest of his life. So now we have to take care of him while he's in prison as paying citizens. And now we also have to help this mother or this family bury their son. So again, VIP Fort Worth is a program that was started in the city of Fort Worth. We have struggled just like everybody else to make it through COVID. But I definitely want to make sure that we understand that COVID had a drastic effect on the inner city. What we dealt with in our communities, especially when it came to the education and again the cabin fever, I remember I would pull up and a lot of the young men in our communities didn't even understand what COVID was. Right? We struggled with just educating those young men on what COVID was. So I would watch and see so many young men gathered in groups still doing the things they did every day like life was normal, right? And if we're honest, these young men are spending time, they're dealing with a pandemic, their families facing anxiety, they're going home and now the house is uncomfortable. Because another reality in our neighborhoods, and again, I came here to speak from where I am. In our neighborhoods, a lot of parents wasn't used to being at home all day long with their children. So they started struggling, and now the children are struggling. And again, and access to guns in our neighborhood is at an all-time high. When I grew up, it wasn't easy to get guns the way it is now. These young men are walking around here with assault rifles. So I believe a program like VIP Fort Worth definitely needs to be funded, not just for the city of Fort Worth, but for this county in general. Because this county is going to suffer as long as this city is suffering. Because the reality of the matter is Fort Worth is the largest city, I believe, in this county. And if Fort Worth has this problem, it can only spread to other places. I was in Mansfield one day and I was talking to this father. And he says to me, I was actually doing an AC job. He said, can you talk to my son? He's in a gang. And when I asked him the name of the gang he was in, it was a gang from Stop 6. So believe me, this is not just a Fort Worth problem. This is a Tarrant County problem. And we have to find a way to eradicate this problem together.
Pastor McIntosh. Gun violence is not limited to the underserved communities in Fort Worth. As you mentioned, there are tremendous statistics in Arlington. There are statistics in Mansfield and Kennedale. There's some in HEB. There's some in White Settlement. It's all over Tarrant County. What would it take and what would it look like for you to expand VIP Fort Worth to serve all of Tarrant County?
Honestly, first of all, for VIP to be able to serve all of Tarrant County, first of all, it would take a massive overhaul. And the reason I say that, as of right now, our program is actually underfunded even in the city of Fort Worth. So first, it would take a massive overhaul just in the structure of our program. Definitely would have to add more admin. But right now, I'm operating with a team of 5 people, and everybody on my team is working part-time to try to heal a full-time sickness, right? Because I also believe that this is mental health. So I believe we would literally have to expand this team from 5 people to 32 people, because just to deal with Fort Worth, I was looking at 16 people with a budget of $1.4 million. That's just to do Fort Worth, and here's the reality of it. The goal was to have 4 people on each side of town in Fort Worth. So I believe if we were going to take on this whole county, then we would have to double the number of people that would just be working in Fort Worth to be able to deal with Arlington, Mansfield, Kennedale, and truly even Crowley, because again, I know this county know it. We have a bigger problem in Crowley now probably than we do in some of the inner cities, and I know it because I worked the program. Literally, they've gotten to the point where, forgive me, they call Crowley Stop 7. If you know what Stop 6 is, then you know what they're saying, right? So literally, it would literally take adding more admin. Definitely would have to have a central location, because right now my program is housed out of the south side of south side of Fort Worth at the Southside Community Center. But I believe this program would definitely have to expand with a budget of around $2.8 million.
How much, you talked about getting the certification. Are many of the young men in your program, do they have high school education?
No, sir. To be honest, some of them do.
Some of them.
Almost
the GED first, and then.
Yes, sir. GED, trade, and college. And here's the thing that we're seeing now, though, because so many of them are so young. Now we've switched from, like, because when we first started, again, there was a lot of shootings, so we were targeting young men that was probably over the 18 to 19 range. Now, Judge Willie, if we're watching the violence come from young men who are younger, we're realizing, okay, man, we need to change our approach to it and talk to them about staying in school, just the necessity of, like, man, focusing on your education. Because, again, at 41, I went back to college, because now I understand that knowledge is power. And I try to share that, and we try to share that same thing with the young men who are in our program.
Well, I want to thank you for spending time with us and laying out your program. I don't represent any of Fort Worth, and even though I do a lot of things with Fort Worth-based organizations and in Fort Worth, I was not familiar with your program, so I just want to thank you for the work that you do. And what you shared, I see a lot of myself, quite frankly, in how I grew up, and growing up in Third Ward and in East Denver, and having to navigate the Bloods and the Crips every day to get to and from school and work. And, you know, I got into enough trouble. I'll just put it that way. But I'm here, and it's because of people like you who invested in me, right? And also because I saw the value in myself. But I understand how important it is that you have to get people to that point. So I just want to thank you for the work you're doing.
Thank you so much.
Thank you very much again. And I think you're heading down the right. Education is going to be a key to, I think, a big part of this. Anything we can do from the GED, working with TCC and doing some of that also may be a big help. But I appreciate very much you being here today.
Thank you.
Thank you, Pastor McIntosh. Next, we are going to discuss our goal 4, which is to alleviate food insecurity in Tarrant County in the wake of the pandemic. And we've asked 2 individuals to come speak to us on behalf of their organizations today. The first is Julie Butner from Tarrant Area Food Bank. And then after her, I'll ask Keith Harrison from Meals on Wheels to address the court. Thank you, Julie. Thank you. Just the center button there.
Okay, great. Good afternoon. Thank you for having me here. I think the last time I was here, Judge Whitley, was my first experience with the mask. And it was all over the place. So I'm so thankful I don't have to wear it right now. But thank you for having me this afternoon. Tarrant Area Food Bank covers 13 counties, of which Tarrant is one of them. In that 13-county area, there are 540,000 people who are food insecure, and 324,000 of those reside here in Tarrant County. This is a look at our pre-pandemic versus current state at the Tarrant Area Food Bank. In FY19, which would have ended in September of 19, we had distributed 36 million pounds of food. Our fiscal year 21 ends in just a few days, and we will have distributed 65 million pounds of food. So nearly doubled the amount of food over the course of the pandemic. And like you've heard from others today, our numbers have gone up in FY21 compared to FY 2020. The pounds of food that we've distributed via mobile distribution, these long get in your car, pop open your trunk distributions, has drastically increased. Many of those distributions are being handled by my own staff, whereas in the past we relied on our 350 partner agencies to do that. Nutritious meals, that equates to 50 million nutritious meals we will have distributed this year. We're projecting that to be 64 million going into FY22, which starts October 1st. Of those 50 million meals, there are 2.3 million that are SNAP meals. This is a huge deficit within Tarrant County. If you look at the Tarrant Area Food Bank compared to its counterparts in Austin and in San Antonio, where we have the same number of food insecure people, they have drastically larger staff associated with SNAP meals. For every one meal we can provide at the food bank, SNAP can provide 9 meals. So it's a much more robust, sustained meal program for those who are food insecure in the community. We are today involved in a 3-year contract with the state that helps to fund this program, and we're on the final year of that. When we bid on this, we did not bid enough resources for the number of people in need in our county. And so Tarrant Area Food Bank is subsidizing this program through community donations to try to make up the deficit between what we should be providing in SNAP meals and what we're currently providing. By way of example, here in Tarrant County, roughly 40% of the people who are eligible to receive SNAP benefits actually receive them. So this is a huge deficit. It's federal funding that brings money into our community that individual community members can take to the local grocery stores and spend. And so it's good. It's a win-win-win. It's good for the individual who's hungry. It's good for our community because we're bringing federal funding into our grocery stores, so it helps the economy.
What was that percentage? Oh, go ahead.
No, you're asking the same question.
What was that percentage again?
About 40% of those who are eligible actually receive SNAP benefits. This is in part due to access, not knowing how to access. You may recall we've recently rolled out a red bus. The sole purpose of the red bus is to take a bus into communities of need and help community members enroll into the program.
So is this education or, is this something, why?
I think it's a variety of things, Judge. I think that in part it's education. It's complicated to enroll, so we're actually sitting down and assisting people with the enrollment process, not knowing where to go to get signed up and enrolled into the SNAP benefit. So I think it's multiple of things.
So it's just purely a matter of if we could educate people to sign up, we could get more?
Yeah, we need to provide access for the sign up, and there's labor involved with providing that access, but basically, yes.
Is there anybody working on that?
We're trying to. So I'll give you an example. Again, San Antonio and Austin food banks have the same people of need in their service area as we do here at Tarrant Area Food Bank. Austin has 19 dedicated resources to this endeavor, and San Antonio has 26. I have 5, 3 of which are funded partially funded by the state. So again, we're kind of wrapped into this 3-year agreement with the state. We didn't bid strongly enough when we bid on it, and so we're short on resources. So
had we bid stronger, would we have had, was it just a matter that we didn't ask for enough?
That's right, we did not.
So we're going to cure that at the end of this contract?
At the end of the contract, we're going to cure it. In the meantime, I'm trying to solve for that gap by paying for the resource through donations. So trying to use some of my funding to cover the cost because it's a significant need here in the community.
And it's nothing we could do with volunteers working evenings or weekends or
No,
anything like that?
it's very specific program where the individual who administers the SNAP enrollment has to go through their own type of training and certification before they can do it.
So I just couldn't volunteer and
No.
somebody supervise me, good luck with that.
No.
Um,
Yeah, there's training that's involved, and we're equipped to provide the training, but I don't think a volunteer would have the sustainability to do that.
Is it something that, and I'm not offering this up per se, right, but that if we had a staff member who could become trained, could they be helpful in signing people up who already are making contact with our office? Or is it that simple? I don't want to oversimplify it because I know especially with it being a government.
No, and I think what you'll see at the end of my presentation, my ask would be, consider some of these dollars going toward funding an FTE that would be added to my staff to help provide this service. It's not that complicated. It just needs some funding. It's underfunded today.
Sure.
Yeah.
Well, and I just heard like urgent need, so, and I get obviously that part of why y'all are here is to tell us about what we can do. So I was trying to think to the judge's point, is there something we could rapid respond to?
I think Rose is writing a check out there right now.
Okay.
If anybody could do it, she could. But it's such a great program, and it's so much more helpful for the community member. Again, it's 9 meals for every 1 meal the food bank can provide, and it infuses federal dollars into our local economy. So it's really, truly a win-win. Home delivery meal program, we identified this during the pandemic, in part because people were sick with the pandemic and were homebound. But then we discovered another population that had other issues, whether it was physical capacity limitations or transportation limitations. And we discovered this in large part with Carla's team over at Meals on Wheels and Catholic Charities. And so this is a need in the community and one that we will continue to provide service to, so those people who are homebound have access to meals if they are food insecure. We had a huge volunteer deficit during the pandemic, like everybody else. We had to cancel things that were happening inside before we had the vaccine. We're hoping that we're going to see that trend back up, and you'll see that in the 4-year forecast here. The number of FTEs on my staff in FY19 were 95. We will have 115 in FY22 to handle this increase in food and distribution of food. School pantries are big. As schools have reopened, thank goodness, we've been able to add the food pantries back in, and this is extremely helpful because those moms and dads that are working, maybe they're working 1, 2, or 3 jobs to make ends meet, this makes it very convenient for them if they are in need of food to pick up groceries when they're picking up their children. We are heavily, heavily involved all over the Tarrant County in helping community members set up gardens so that people can learn to grow their own food right where they live. We started 8 new gardens this year, and we're anticipating 30 new gardens in FY22. You can see what's happened to my budget in order to meet the demands and to meet the need.
Before you move on, I recall maybe it was pre-pandemic, there was a program that you all had where you helped to get people back in the workforce, and they were like trained, I'm going to say to be a chef, but that they probably weren't technically chefs.
Right.
But what was that program, and were you able to keep it going during COVID, and if not, has it resumed?
Yeah, no, we were not able to keep it going during COVID. We have relaunched it. It's entirely different. I'm very, very proud of it. We are on our 4th cohort, or our 4th class. All those who have graduated are now earning a living wage in the $16 an hour range. We are partnered with the Taste Project, which is a pay-what-you-can restaurant, the Fort Worth Culinary School, and the Workforce Solutions, which makes this program entirely different than what it was pre-pandemic. Workforce Solutions is helping to pay a stipend, so I pay 50% and they pay 50%. And the Fort Worth Culinary School, through the American Culinary Federation, can administer a test These students come out with a cook certification, which is why they're getting $16 an hour instead of $10 an hour or $7 an hour. So we're really proud of that program. And hope to expand to a warehouse job training program at the end of this fiscal year. Warehouse jobs in the Metroplex are paying $25, $28 an hour, so certainly above living wage rates. Am I pointing in the right direction?
Would you talk to me about going back to the SNAP program? If only 40% of those who are eligible for the program are enrolled, and the leverage in terms of meals under SNAP is 9 to 1, why aren't we concentrating more resources on signing people up for SNAP? You're asking for 1 FTE.
Oh, no, I'm planning on increasing that staffing to 15 FTEs. We're significantly behind. And so I'm looking for all sources of revenue to cover that cost until this contract is renewed with the state of Texas.
And when is that?
It's got one more year left, so it's like September of 22 would be the year. Unless they do a one-year extension, and I've already put in, and they can do that, I've already put in a request through Feeding Texas, who negotiates that contract on behalf of all 21 food banks across the state of Texas, that if they put in a one-year renewal, that they reconsider the distribution of the allocation of those funds because of the number of people in need in our service area. We're not getting our fair pro rata share of that funding today, and it's because when the grant went out, 2 years ago, we didn't ask for enough. COVID-19 response I have here. We remain committed to increasing services and food distribution and production to meet the needs of the community. We're doing over 1 million meals per week, 65 million pounds of food this year. That's an 80% increase than pre-pandemic numbers. We pivoted to a direct-to-client mobile distribution model that was served by my own team. We worked with a network of 350 partner agencies. That's anything from churches to boys and girls clubs to Presbyterian Night Shelter to schools to colleges and universities to help them pivot and change their distribution methods. We had significant disruptions in the food supply. We're experiencing that again today. We hired furloughed hospitality workers from John Bonnell and from Tim Love and many others in the community when our volunteer support was lost due to the pandemic. And we finally petitioned Governor Abbott and received 90 men and women from the Air National Guard and Army Reserves.
We're about to be through.
We're going to lose a quorum.
Yep.
We also developed last mile delivery solutions for the homebound that I mentioned earlier. We partnered with Texas Rangers, AT&T, Cotton Bowl, Fort Worth ISD Dickies to offer the mega mobile markets. And then we produced 21 million nutritious meals for our children. We packaged ready-to-eat, child-friendly foods in emergency boxes. And then our Mission Kitchen pivoted from being a training site to a production center where we produced ready-to-eat meals to put into those emergency boxes. Areas of new and unmet need, we think that we need to be involved in policy, system, and collective impact changes. So as the community and as the county is thinking about what policy changes we want to make, what legislative initiatives we want to be a part of in order to have a significant impact on food insecurity, Tarrant Area Food Bank would like to be involved in those discussions. Implementing solutions for Tarrant County residents who are facing food insecurity, and providing sufficient funding to address the new unmet needs. So where we had a budget of $12 million, that's without food. to address food insecurity. Today, it's $18 million. This last fiscal year, we managed $150 million worth of food. Here are some suggestions for the American Recovery Plan Act funds allocation. Food purchases. A lot of the food that we received, it was really money that allowed us to go and buy food, came from the TDEM funding, which is Texas Department of Emergency Management. We received $6.8 million last year from TDEM to buy food. We will lose that funding, and so we're looking for other sources of funding for those food purchases. Operational distribution costs, the SNAP assistance, which we've already talked about, workforce development, return to work programs. Our Fort Worth program is doing extremely well. We, as I said, want to start a warehouse job training program in conjunction with Walmart. They have suggested that they would be willing to help us with that. Children's initiatives that are not funded by the federal SNAP education program, such as the in-school pantries. We're planning on opening 60 in-school pantries across Tarrant County this year. Children's summer camps. We've developed a food insecurity education toolkit that we're rolling out beginning tomorrow with the Jordan Elizabeth Harris Foundation, where the Jordan Elizabeth Harris Foundation is introducing us to the 89 schools that they currently support with Hope Squad, and we will be introducing this food insecurity educational toolkit to those schools. I met with the junior ROTC program within the Fort Worth ISD, and across Fort Worth ISD, JROTC is going to be assisting Tarrant Area Food Bank with putting in community gardens at schools. So those gardens will be right in the community. They will be used as an educational forum to teach children about food and nutrition, but also provide fresh produce to families. We learned during the pandemic that we don't have an emergency generator, and sometimes you need one. The city bailed us out, so we were grateful for that. Community-based urban farms are happening in a lot of other counties across the state of Texas. We would love to be involved in a development of an urban farm that would be able to produce more fresh produce. The home delivery meal program that we want to continue to provide, and then capacity building for those 350 partner agencies that reside inside the communities and are serving their communities. We would like to re-grant funding to help them expand their services, which in turn helps us build our capacity.
Do you know whether the TDEM money under food purchase, did that come out of their CARES fund or out of their ARPA fund, or do you know?
I don't know. I don't know.
Russell will figure it out.
And I know that they have communicated that there's no intention to replace it with TDEM funding. I know that Feeding Texas is lobbying to try to replace that with some other government funding, federal government funding.
Okay, thank you.
Can I answer any questions? Okay, thank you very much. I appreciate your time.
Thank you.
We're at a point now where we are going to lose a quorum of the court.
Now, we can still have we can have a work session. It'll just be a continuation.
We will need to adjourn court.
You need to adjourn the court, and
right.
They can still present to less than a quorum, of course.
Well, technically, as long as JD's on, we don't have a official quorum, but we have a quorum. We have a majority of the court listening.
Yeah, and I would probably advise that Commissioner Johnson may want to go ahead and exit as well. I don't think he would.
Why? It's not a quorum.
It's not a proper meeting.
Well, I mean, that's because the governor said it wasn't a proper meeting.
Absolutely. But you still have a majority of the court listening, which could present a problem in a legal proceeding.
And so what we'll need to do, we'll need to adjourn court. We'll continue with the work session, and we'll continue our video of this, and we will continue to put this on as attached to the court minutes, which is a video, And so people can go online to hear the rest of this also. One of the concerns we have is you have 3 of them, 2 of them only here. You don't, but you have 3 members of court. This is totally going to preclude a lot of questioning because you can't share information like that.
Absolutely.
If we have 3 listening.
Yes.
It is.
JD, you're gonna owe us. Because you're gonna have to get off.
We'll make sure we contact him.
I've been on.
No, you're gonna have to get off.
Get off?
Yes.
That is no problem, senor.
Thank you, sirs. I'm having to leave because I had to rearrange my schedule because of the special session. So sorry for everyone that's been here. I would love to hear what more you have to share, but my staff will fill me in, so thank you.
Bye, JD.
Good night.
We stand adjourned. Now let's continue. Keith, are you next?
Just give us a second, Judge.
Good afternoon, Judge, Commissioner. Like everyone else, I wanted to thank you for the opportunity to come and speak to you this afternoon. We have a lot of information to cover, so we'll go through it pretty quickly. But before we get started, let's see, I don't think, there we go. But before we get started, I wanted to take just a moment to thank the court for your support. This morning you voted on a resolution and a matching fund of just over $58,000. And I wanted to say thank you and let you know that that support directly funds nearly 8,400 meals for Tarrant County seniors. But more importantly, it's a requirement for a grant that we get from the Texas Department of Agriculture that averages about $1 million a year. It's a little bit less this year. So with your support, since 2009, we've been able to leverage over $13.5 million in state funding, and that has resulted in nearly 2.2 million meals for Tarrant County seniors. That would not have been possible without your support. So we just wanted to say thank you. As we move into the presentation, I wanted to start with the year 2016. That was a benchmark year for Meals on Wheels. It's the year that we completed construction of our new facility in Haltom City. And that year we served just over 4,300 clients with 926,000 meals and a budget of $6.7 million. At the time, Tarrant County had a population of 1.8 million residents, of which 270,000 of them were age 60 or over. So at the time, based on population projections for Tarrant County, we anticipated a 75% increase in needed services by the year 2030. So that meant by the time that we got to the year 2030, we would need an additional 750,000 meals every year just to keep up with the demand. So if we look at a year-to-year comparison, we just talked about 2016. Our next year is 2019, so the year just before the pandemic. You can see our numbers were down just a little bit, and frankly, that was because funding didn't keep up with the need in the community. But we still served over 4,200 clients with 896,000 meals. And although we served just slightly fewer clients and meals, our budget increased to $6.8 million that year. Then 2020 hit, and along came COVID, and the world turned upside down for just about everybody. You can see in our client count, we had a 57% year-over-year increase. So we served almost 6,700 clients in the year 2020 with 1.3 million meals. So we had a 45% increase from the previous year in the number of meals we served, and our budget skyrocketed to $9.8 million. It was a 44% increase over our 2019 budget. So if you talk about our COVID response, we now have 3 meal plans. At the time before that, for the past 48 years, we've had our home delivered meals program, and that's what most people think of when they think of Meals on Wheels. It's a hot, ready to eat meal that a volunteer delivers to someone's door. Those meals are available to those who are homebound, either physically or mentally unable to prepare meals for themselves, and they have no support system. Then in 2020, we launched our supplemental nutrition program. And Judge Whitley, frankly, that program came about from a concern that you expressed over people who were not being served during the pandemic, who were kind of falling through the cracks. So we launched our supplemental nutrition program, and that's available to those who are age 60 or over who lack access to food. And they get a weekly delivery of frozen meals and fresh produce.
And I'll say that came directly as a result of the Monday
Yes, it
morning
did.
calls where we had groups together and there was an expression of a need. And again, y'all stepped up and we appreciate very much y'all taking care of that need.
Thank you, sir. Our congregate meal program, so you're probably aware there was another organization who for many years operated a congregate meals program in the community. In 2020, they decided they could no longer do that. So Meals on Wheels stepped up and to fill a service gap in the community, launching our congregate meals program. And that is available to mobile adults in the community who are age 60 or over. And they receive nutritious meals in group settings at adult activity centers around the community. And so not only do they benefit from the nutrition they receive, but the social interaction helps combat loneliness and depression and isolation. So that's very important for those folks. So it kind of brings us today. So where are we today? By the end of 2021, we will serve 1.5 million meals. This is a little mind-boggling for us, but looking into next year, we're projecting we will serve 1.7 million meals in 2022. And believe it or not, that is a 90% increase from where we were in 2019, just before the pandemic. And it's where we thought we would be in the year 2030. And then, yeah, that's what we said. And then our budget has been right on track with that. So our budget has increased to $12.9 million next year. That's a 90% increase, almost double from what it was just 2 years ago in 2019, right before the pandemic. So when we talk about food insecurity, there's an alarming statistic. It says 1 in 10 seniors in Texas is at risk of hunger. So what we do at Meals